All right, it is Tuesday, November 13th, 2018, a few minutes past 6 p.m. I'd like to call to order this meeting of the Policy and Services Committee. If the clerk would please take a roll.
Councilmember Du Bois? Here. Chair Fine?
Here.
Councilmember Holman? Here. Councilmember Wolbach? Here. 4 present.
Thank you very much. Do we have any speakers on oral communications? None. Let's move right to action item 1, review and acceptance of Fire Department Emergency Medical Services Future Needs Assessment. Chief Nickel, if you'd please take us off, and then we'll take public comment after that.
Great. Thank you, Councilmember Fine and council members. Thank you for the opportunity to get in front of you tonight for a very short period and really peer over the horizon and look at what the emergency medical service needs could be like, projected to be like in this city through the year 2030. We want to thank you. Council sets priorities about what are important through the city budget, and I do want to thank you for making this a priority and giving us the money to take a look at this, because you've heard me say before that I am very concerned, particularly around the ambulance operation that we operate and the aging of our community that is aging into this high-risk group. We're going to take a very high-level look at this tonight. I know you've had an opportunity to read the report. And we are available for questions after we've presented. I would like to turn this over to Amber Cameron, who takes care of a lot of really important strategic projects for the fire department. She's the one who really spearheaded this tonight, and I'll let her kind of describe what we're going to show with you.
Great. Thank you, Chief. My name is Amber Cameron. I'm the Strategic Operations Manager with the Fire Department. And this project was an undertaking that took about 18 months to complete, and it's really taking a broad look at the health of the community and how it will impact the fire department in the future. We use both qualitative and quantitative data collection and analytic methods in order to get both direct community input as well as utilize a variety of relevant data sets. What you're going to see is that the emergency medical needs of the community make up the majority of the service demands of the fire department. That our older adult population utilize our services at a disproportionately high rate, and that with aging populations predicted to grow, we're expecting service demand increases in the future, especially over the next decade into 2030. We also wanted to look at some evidence-based models for potential alternative services to consider to possibly address this growth in the future. And right now, so we're going to be moving into an exploratory phase after this phase, just to determine if we can develop some partnerships and look at possibly implementing in the future. Sorry, go ahead.
Before we turn it over to our consultants, there are two things that I want to point out. One, what we're presenting to you is in alignment with the fire department's strategic plan. The community did identify in our strategic planning process sort of the emergency medical service needs further in the future and how we would meet that. And number two, when the organization went through accreditation earlier this year, our outside peer evaluators said they'd never seen a fire department do something of this magnitude. This essentially is a strategic plan for taking care of our citizens, primarily our older citizens, and so they had never seen a fire department do that. So if you think about the accrediting agencies, look at the cutting edge of what fire agencies are doing, we're actually on the cutting edge of what the cutting edge organization says. So this is something the city can be really proud about, but it's really getting back to what we do with the fire department, and that is preventing issues from occurring in the future. So with that,
and actually, I'm going to turn it over to Jen Van Steel, with great thanks for all of her work, as well as Melanie Espacino for their work on this project. And they are going to review the highlights and some of the details of the data that you'll find in the report.
Thank you, Amber. Council members, thank you so much for having us today. I really appreciate your time. And Chief Nickel, it's been a pleasure to work with you and your team on this study. So my name is Jen Van Stella, and my business partner, Melanie Espino, is here in the room. We work for the company called Actionable Insights. It's a community assessment and program evaluation firm. We also do strategic planning and other kinds of research. But what we're going to present to you today is the research that we've done with Palo Alto Fire. And we'll talk a little bit about the project goals. We'll give you a brief overview and review the results, and then we'll talk about our recommendations and what some next steps might be. So for the city of Palo Alto and Stanford, the study was intended to predict what the fire department's call volume and medical emergency patient volume will be 15 years down the road, so in 2030. And we also dug down into the research and literature to understand effective models that are used by other emergency medical services agencies to prevent or to mitigate the increased call and patient volume. The study also included a community health needs assessment, and that information is available in the report, but for the purposes of tonight's presentation, we're focused just on the predictive analysis and those recommendations. So what did we actually do? We conducted a statistical analysis to get some insight into the future emergency medical needs of Palo Alto and the Stanford community. I'm going to describe the data generally, and then I'll share the results about the city and some of the results related to Stanford. So the data that we used from the city included data from Palo Alto Fire's city systems. We took an average of 2 years of data to get better data stability, and looked at calls by type, so fire calls, medical emergency calls, and calls by jurisdiction. So we just looked at the city of Palo Alto and Stanford. We didn't look at any other jurisdictions. Sometimes multiple units will respond to a call, and so we had to unduplicate so that a single call wasn't represented in the data set multiple times. So we spent some time with the data. We also took data from the Census Bureau's American Community Survey 5-year resident population estimates. And that includes age for both of those areas. Now, the predictions for 2030, we use the Department of Finance's 2030 estimates, and those, again, include age, the city's growth scenarios, which we'll go over in a second, and Stanford's growth estimates from their general use plan application. So I do want to point out that the data from Stanford doesn't allow for age projections, so just to keep that in mind as we go through. So the growth scenarios from the city of Palo Alto's Planning and Community Environment Department, we started with the base figures, right, of population and jobs. And in the scenarios, and I'm showing them here on the screen, the city varies the increase in the number of residents based on housing estimates and the number of jobs that would be added. So the first column there on the left in the slide you can see is population change, and the middle column there is job change. Now, the Stanford worker growth estimates are shown on this slide, and again, that's from the general use plan. We use this for the daytime population overall at Stanford, so essentially folks who are staying there, the students and commuters, but we didn't have actual commute data, and so we don't know what the existing age proportions are, so we couldn't make accurate estimates by age for Stanford. So just, again, to let you know, age really matters because it affects the medical emergency call volume and patient volume. Now, yes?
I mean, but you know, the bulk of students are within a certain range.
Of course, yes.
Statistically, it's probably.
Yes. Yes. The issue is that the workers are of a very varied age range, and although we did contact Stanford several times, we were not able to get the age ranges from the actual data. So rather than try and estimate that on our own, we thought, well, we'll just stick with what we've actually got. For residents, so I don't show this on the slide, but the resident population of Stanford is about 15,000, and it's projected to be 20,000 in the year 2030. Okay. So for the city of Palo Alto, the data that I'm showing here is the current calls to Palo Alto Fire from the city of Palo Alto, split by time of day and also split by call type. So the chart on the bar on the left is the daytime calls, and the bar on the right, the nighttime calls. The red part, or the orange part of each bar, shows the medical emergency calls. Okay, so you can see that the daytime calls are significantly more than the nighttime calls. In fact, they're 2/3 compared to 1/3 of nighttime. And the orange sections, the medical emergency calls together, make up 70% of Palo Alto Fire's calls from the city of Palo Alto. So medical emergency call is quite high, right? 70% of all call to Palo Alto Fire. In the next slide, we're going to take a deeper dive because of the bulk of the call volume being medical emergencies. So here you see the medical emergency patient volume from the city of Palo Alto, and this is broken out by age. And you can see that the numbers go up, the numbers go up for the folks who are 55 and older, right? So those numbers are much higher than in the other age ranges. Now we're taking this chart and overlaying it on a chart of residents. So the orange bars in this slide are still the medical emergency patient volume bars by age, and the blue bars are the resident population by age of the city of Palo Alto. Okay? And yes, so the orange bars are the medical emergency patient volume from the city of Palo Alto, and the blue bars are the resident population of the city of Palo Alto. Yeah. And again, you can see that those who are age 55 and older are a much higher proportion of the medical emergency patient volume compared especially to their representation in the resident population of the city. They're about 61% of the medical emergency patient volume. I also want to point out the bubble of the 35 to 54-year-olds that are going to be aging into the higher utilization group, right? So the issue of population age goes into the predictive analysis, which we're going to talk about in a sec. So all the data slides so far have been for the present. The next slide is comparing to future predictions. So this slide has population by age, again for the city, and for each group of bars, the gray bar on the left is the current population of residents. The middle bar in each group is the projected scenario number 2 for the city, which is the lowest projection of resident population. And the darker blue bar on the right in each group is the highest projection for the city's resident population in 2030. You can see that, again, the age ranges 55 and up are going to be increasing, and the others are relatively flat, or even in the case of the younger group, declining, right? So this is what some folks call the silver tsunami, right? The older population is expected to increase. On this next slide, we're looking at the calls by type, and the gray parts of the bar are the current call volume for each call type from the city of Palo Alto. The lighter orange is the minimum predicted increase, and the darker orange is the maximum predicted increase. So the minimum predicted increase is pretty sizable already, about 25% or a quarter of the call, and the maximum is 34%, so over a third more than are currently happening. So medical emergency is really expected to increase between now and 2030. The patient volume similarly is expected to increase, and this is again the current year in the gray bars. The lower prediction in 2030 is the middle bar, the light orange, and the highest prediction in 2030 is the dark orange, the right-hand bars in each set. And again, we see the largest increases both in population, as we saw, and in medical emergency patient volume among the 55 and older age group. So medical emergency patient volume is predicted to be 68% of the city of Palo Alto's call in 2030. It's currently 61%. Okay. Now, I'd like to go to the Stanford data. We've got just a few slides on that. So this should look familiar. It's the same sort of format. This is calls to Palo Alto Fire from Stanford in the current period. And you can see that the daytime and nighttime call are a little more comparable than they were for the city of Palo Alto. There's not as big a difference between day and night. Medical emergency calls, the orange parts of the bars, are about half of all calls to Palo Alto Fire from Stanford. The medical emergency patient volume from Stanford, I think you would expect this to look this way, right? The youth and young adults are the largest proportion of medical emergency patient volume. But there are some calls from an older group, and that is basically not just the residents, but visitors to the campus. So Stanford is where the call originated. It's not necessarily just the residents of Stanford. Now looking at, again, this is this overlay of the medical emergency patient volume by age compared to the resident population at Stanford. There's a higher volume of medical emergency patients among the 35 and older population compared to the residents of Stanford. Finally, I'd like to look at calls by type for Stanford. Again, medical emergencies on the top there, and the current year is the gray part of the bar. The increase is expected to be about 36% for medical emergency patient volume, or sorry, calls by type. And that isn't due to the aging population, but in this case to the increasing population on campus. I should note that the false alarm calls that you see there, it probably will not go up as much as are predicted here, just because Palo Alto Fire is implementing a program to prevent false alarm calls. Now, the main findings are that the projected increases in both the resident and the commute populations are what are driving the predicted increases by about 30% in the call volume for both areas by 2030. The daytime call volume in the city of Palo Alto is expected to remain higher than nighttime. The Stanford call volume overall will increase because the campus is growing. The projected aging of the resident population is what's driving the predicted increases in the older medical emergency patients in 2030. And we know because of the demographics that Palo Alto Fire will have a greater number and proportion of older medical emergency patients from the city of Palo Alto in 2030 than they will from Stanford. So what can we do about it? Well, we did do quite a deep dive into the literature on models that address emergency medical services patient volume and call. But just to set the context, I do want to summarize what we saw in the national trends. So hospitals are seeing increased emergency department visits, and they're mainly for chronic diseases, chronic conditions like heart disease and diabetes, and also for substance and alcohol-related issues. About 40% of all ambulance utilization nationwide is due to a relatively small set of individuals that the industry calls super users. Palo Alto Fire's definition of super users is pretty consistent with other jurisdictions. It's individuals that call more than 3 or 4 times a month. These folks typically don't have a support structure, or they perhaps are losing their ability to maintain their independence. It's usually not a true emergency when they call, and they may have an underlying mental health issue or some other kind of socio-emotional issue. The unfortunate part is that California regulations only allow home treatment and release or transport to an emergency department. Right? Palo Alto Fire can't take them to some more appropriate venue, like a mental health facility or an urgent care or something like that. So the other piece on the slide that I want to draw your attention to is the fact that nationwide there's been an increase in emergency medical services calls to fire departments. In the last 30 years, it's gone up from 54% to 64% nationwide. So that's 10 percentage points, 20% overall increase. So I'm going to hand it over to the chief now to talk a little bit about the recommendations that we have.
So thank you. Excellent presentation. Really great summary of a very detailed report. We're not asking you this evening for any resources or allocate anything. We wanted to put this on your radar screen as one of our important roles is planning for the future. And like I said in my opening, this is an opportunity for us to peer over the horizon. You've heard me say multiple times that I am concerned about the silver tsunami, and as our citizens age in place, we do know from our data that they use our services, and we just want to be prepared for that. Certainly the things that we're sharing with you this evening, these prevention approaches, are in alignment with our mission and our values. We are all about trying to reduce the community's risk and prevent these emergencies from occurring. There are some really excellent evidence-based models that are out there right now. They fall under a multitude of different terms: community paramedic, mobile integrated healthcare, but it's essentially taking the emergency response vehicle or the field personnel and getting out in these homes and trying to prevent the medical emergency from occurring, whether it's a home visit, whether it's in consultation with the hospital, whether it's doing some sort of medical care in the home versus transporting them to the hospital. Much less expensive, much safer, much better for the patient. We want to do, we're proposing a pretty aggressive outreach and education program that again, back to our fire prevention model that we've done before that has minimized fires in buildings. We want to use that same approach. And then clearly, particularly with the Stanford Medical Center and with PAMF and some, really some of the best and brightest in the world in the medical industry here, partner with some of these, medical facilities, partner with social services, say like in Avenidas, that really is mission-driven around taking care of aging citizens, to try to put some sort of collaborative team together that would reduce these. The most expensive thing would be to add more resources, and that's not what we're asking for. We want to continue to move forward and look at some of these potential approaches where we would take a preventative approach. So that's our presentation this evening. We would be open to any questions that you have or any comments.
Thank you so much, Jen and Chief. Thank you very much. Do we have any public speakers on this one? Awesome. Thank you. That was a really good presentation. I know you condensed a hell of a lot into a short few minutes, and there's a lot more in the packet here for us all to review. I just want to remind my colleagues there is a little bit of a synopsis of kind of the next step of the community impact planning phase, which is no cost to us. Thank you, Chief. About bringing these alternative service models to Palo Alto. With that, I will open up to any questions. I saw Councilmember Wolbach first.
Yeah, I want to echo what Chair Fine said. I really appreciate the work that went into this. I just wanted to check if you'd heard that of the various scenarios for growth that we had anticipated, we've finished the selection of that, and so that's a done deal as far as our anticipated growth. Of course, no plan ever survives first contact with reality, but just, for maybe as you move forward, we can update that now that we know what our projected growth scenarios are for jobs and for housing and population, at least to narrow the range of possibilities somewhat. Do we have a sense on timeline for phase 2 and when that would be coming to the council and the Policy and Services Committee? Estimated even, just to get a sense.
I can take that. So we have not yet begun that phase. We wanted to first present this information and just get some general feedback from you. We are looking at beginning the phase after the spring of next calendar year. So it could be anywhere from 12 to 18 months after that we would come back.
Okay. Well, I think that this is very much moving us in the right direction. Speaking from personal experience, my family, my neighbors, what I see in the Palo Verde neighborhood, I can speak about anecdotes, but here you have data to back up what I've seen in my neighborhood, and so I really appreciate that, and it matches what we hear from a lot of other neighborhoods as well, and so the evidence and the research is really invaluable. So thank you very much for this, and thank you to the chief and the entire department and the consultants for prioritizing this long-range planning. And it is something to be proud of as a city, as a department, being this ahead of the curve, and really thinking about how this is going to positively impact the community in the long term.
Councilmember Holman.
Yeah, thank you for the presentation and for getting a leg up on this, so to speak. A few questions. One is, how was the GUP factored into this, the GUP potential growth? I didn't see any accommodation for that.
Sure, I'm happy to take that. So we used the figures that were presented in the GUP as part of the predictive analysis. So the projected numbers for the population were employed for the analysis.
I think I can probably add to that too. We did make some comments in the comment period as the city's response to the GUP was being prepared. I would also remind the council members that that is a clause within the Stanford fire contract that should this growth start impacting calls for service, that is a trigger that we have to sit down with Stanford and continue a new dialogue around what types of impacts that has on the fire department. So we've approached it kind of future with the GUP as well as current with the fire contract. I hope that answers your question.
Des, glad to hear that it's on both levels you've factored in, because the numbers look kind of low, actually. Also, how did you factor in, we always hope we aren't going to have a disaster, but, we keep saying like, well, we're doing earthquake. So is there any kind of reasonable or feasible way to factor in a percentage accommodating or allocating resources for, appropriating, I guess would be the right word, appropriating for an emergency?
So in this study, no, we have not done that. We basically just took a snapshot of our 2 years' worth of call data out of our computer-aided dispatch records management system. I would have to do some research to see if there's any clinical studies out there that, does an event of that magnitude cause a 10% rise in call volume for that period of time? I've not seen that literature out there, but we can certainly take a look at that and see if there's anything out there that resembles that, because we did not build that into this formula.
Kind of hard to imagine that it wouldn't cause a spike. And you can't predict when, but just like making some kind of accommodation for it. I guess it's also on your slide, if I can find it quickly enough. Yeah, I don't know what slide number it is, but on page 12 of the handout here. The integrated healthcare model, like home visits and stuff, is there increased liability with that?
Excellent question. There certainly can be.
I try.
That's a great question. Because this is such a new field, much like when your predecessors were here in 1974 trying to figure out, do we get into the paramedic business? It's a very new industry. Mobile integrated healthcare is probably no more than 5 or 6 years old. It's certainly a different, imagine a paramedic who's also a social worker. And so there are some liability factors that we would have to consider, and that would be one of the considerations if we did come back asking for support, that we would obviously vet that through the city attorney's office and what are the legal issues out there, because there are some things that we do out there that could expand the scope of the paramedic. And it could, expand the scope of risk, but those would certainly be something to look at. Great question.
So, I'm not going to put the city attorney on the spot, but we are self-insured in many regards. I don't know if this is some area where we'd want to look at that as well. And there's reference here to partnering with other organizations, but, they might also be taking on additional liability. So how willing are they going to be? How much conversations have been occurring with those other organizations?
So in those circumstances, it's not too different than how we operate now with our emergency paramedics in the field. We're operating under medical direction of a medical doctor, and we contract with the Stanford Emergency Physicians Group to provide that medical direction. So when our paramedics administer a drug or a narcotic, we are administering it under that doctor's medical license, and we have to follow very strict medical control. So this would be very similar. So in envisioning a scenario, we would partner with Stanford Healthcare. We would be under medical direction of their physicians, and we would be working within some very strict protocols or guidelines. And if anything is sort of out of the norm when we're doing one of these home visits, that's where the telemedicine piece comes in, that we would make contact with this person. Some of the other models out there put a nurse practitioner or a physician's assistant and pairs them up with a paramedic. So now they're working on, now you have a higher level of care with a paramedic that are also working under a physician's license and medical control. So there are many, many sort of safeguards built into that
Okay.
do mitigate some of these risk issues.
Okay, very good. And then my last question is kind of a bigger question that nobody has the answer to, I'm sure. And that is, a lot of people go to emergency rooms, go because they don't have insurance. And even though we do have greater access, is there any thought of how that might be addressed, or is that just too big of a question and we're not even beginning to grapple with it? Is anyone looking at that?
So I appreciate the question. My firm is working with Stanford Healthcare and their hospital and other hospitals in the four-county area on community health needs assessments. And one of the needs that they've identified has been access. And they are dedicated to working on access issues. So what you're describing is something that the hospitals are already thinking about.
Is there anything to report out of those discussions, or is it premature, or?
So the current round of community health needs assessments will be done in the spring and summer of next year, and the hospitals at that point are required by the IRS to develop implementation strategies to address those needs, one of which will almost certainly be access, because they do it every year. And at that point, those reports become public. So generally, the reports on the implementation strategies come out 4.5 months after the fiscal year close. So for Stanford Healthcare, Melanie, can you remind me, is it December that they're?
Right.
Okay, so.
December, so their fiscal year ends in August. And surely
If
their,
you need to be on mic.
I apologize.
so their 2016 report is already public, and the things that they're implementing in the current cycle for their community benefit investments are already known. But as Jen is saying, the new one will be coming out in 19 in the early part of 2020 for Stanford Healthcare.
Okay, very
And they
good.
do, I mean, to give you a sense of how they address access around that, they do things like putting more folks out in the community who know about insurance programs and plans, can get people enrolled and make sure that they're taking advantage of the benefits that they are qualified for, things like that. And then addressing issues like transportation, getting people to federally qualified health centers and the like, but certainly having more practitioners out in the community is something that many communities have identified across the Bay Area.
Okay, good. And as I wrap up here, anything to add to that, Eric?
The only other thing I would add, Councilmember Holman, is we are a microcosm of the healthcare issues that are going on nationally. The city has a healthcare system. It's called your fire department, and that takes care of the community, and we transport patients regardless of their ability to pay. So, great question, and we're on the front lines of that.
Great, thank you very much.
Councilmember Du Bois.
Thanks. So this is really interesting. I'm really glad you guys are working on this. So thank you. And thank you for reminding me how the Stanford growth worked. That was one of my questions. I was curious, when you're forecasting age of populations, were you considering if the Palo Alto population would be shifting from more family-oriented to professional singles, or did you just kind of project the current mix?
That's a really interesting question. So we used the Department of Finance's projections. So we ourselves didn't project the population. The Department of Finance projects the population. And while I don't have all of the details about how they do that, my understanding is that they do take that into account, but I don't know
This
for
is
sure.
part of the Census Bureau?
The Department of the California Department of
Okay.
Finance is the one that publishes those projections by age.
Okay. And I guess, I don't know if you're done with this report. I think if you were revising, I think one suggestion I'd have would be to beef up the executive summary with more of the recommendations. I think those are the most interesting. I think, once you buy into the methodology, it's really like, okay, what do we do? And kind of a related question to the demographics. I think, Palo Alto is a highly educated population. And so when you look at recommendations, I would, and I think you say here that every community is different, but I would expect kind of the typical things that work in other cities might not work here. You might want to consider other kinds of ideas. And again, I'm really interested in hearing kind of the next step of how do we deal with these super users. One thing that just popped in my head was, we're talking about transportation network, and I think in particular, our senior transport is not as great as it could be. So, maybe we have a dedicated senior shuttle that's more like a ride-sharing service to health facilities. certain hours of the day. So maybe it's a commuter shuttle, but then the middle of the day can be used for other things. And then a couple other thoughts. So there was some Stanford Health money, and maybe you know, Rob, I don't know if we spent all of that on Track Watch. I seem to remember part of that was for senior services, but could be remembering wrong.
Good evening, council members. Rob DeGose, City Manager's Office. I have to go back and check to see where we were. We had $4 million dedicated for health services specifically. $2 million was specific for Project Safety Net. Almost all of that was spent on track-related security. And there was an additional $2 million, and I want to say a lot of that was related to track security as well as we transitioned to cameras. I'd have to go back to see if there's any balance in
Yeah,
there.
I don't know if we managed to save any of it. It seemed like this would be a good use. And then I think another additional aspect that would be interesting if you continue to work on this would be incorporating some of the response data time. I mean, I know this is kind of an idea that's different from response time, but I still think it would be interesting to incorporate that in and kind of forecast, that interplay of if response times continue to increase the way we've been seeing them increase. And kind of related to that, my question for you was, does the fire department participate in reviewing kind of roadway changes in general?
Absolutely. So that would come through the Fire Prevention Office, the Fire Marshal's Bureau. We've got fire inspectors that would look and review those types of things. So we look at all those road changes related to Stanford. And again, part of the new contract, they're required to provide notification to us of any road construction issues because there are some delay provisions in the contract that if we're delayed on responding to calls, that again is another way that we have to sit down with them and talk about that. So they've been very good about providing that to us. So we get it from both jurisdictions.
From the city and
Correct.
campus?
Correct.
Yeah, I mean, and we just had a discussion about traffic and congestion and just concerns. Certainly at certain times of day, there's, kind of near gridlock conditions in places. And then the last question I have is kind of, how do you get better at figuring out whether a call is an emergency call?
Funny you should ask that. We've been having that dialogue, like what is an emergency and what are we tracking as an emergency? Actually, the thinking in the fire and emergency services business right now is moving from sort of this output, and an output would be a response time, to outcome. What actually happened to the patient? Did we confine the fire to the room of origin, or did it burn the whole house down? So we're moving more towards this outcome-based, sort of evidence-based, that yes, our intervention with early CPR and an AED deployed from the police car and paramedics and multiple firefighters saved that person's life. So we're looking at that now. So we do a lot of thinking around that, both response times and outcomes. The other thing I would remind the council, and again, back to how councils set priorities from my perspective as a staff member, I would thank you for providing, $500,000 in capital funds for our signal preemption program, which Amber is also leading that project, that will tie into our dispatch computer and the call location and the apparatus that is responding and synchronize the lights turning green to get us there quicker and safer to clear the intersections. So we're doing things using the technology, using the tools that we have right now to get us to these calls faster.
But in addition to the super users, it seems like when you do get an emergency call and you show up and it's not an emergency, right, I guess you still need to go there even if it's a mental health issue or some other issue.
That's true, and we have one other mechanism. We prioritize all of our calls that come through 911. Our dispatchers are all medically trained. We use a nationally recognized, it's called MPDS, Medical Priority Dispatch System, that prioritizes calls A through E, E being the most severe. But that's a whole separate conversation. So when you start putting all these things together into a system, we try to minimize what are true emergency calls, but until we actually get trained people there that can make contact and go, okay, not an emergency, or uh-oh, this is real serious. But we do a really good job of triaging these calls down, because we don't go code 3 at all calls. we don't send 2 units to all medical calls. So, and it's continuing to evolve and get better.
So again, thank you very much for this. Just want to put a point on some of the questions my colleagues had about, we do have some agreement now in the city about our commercial and residential growth scenarios, and Stanford's GUP is kind of coming into focus. So if we can refine this study for that, it would be super helpful. Councilmember Du Bois brought up the issues of super users. I'd also add on inappropriate or non-emergency users of 911. I'm just guesstimating, but it looks like 65% of our calls are these super users or non-emergency users. Just looking at the slide here. Those are national numbers? Oh, okay.
Let me just address the super user. We are pretty aggressive. So our EMS chief, Kim Roderick, works, when we have identified through our field folks that we do have a super user, we immediately jump on that and we start trying to work with that patient's doctor and the medical doctors that we take our direction from to try to resolve and find some other care, social help, mental health. So we try to jump on that very fast.
Excellent, thank you. And just kind of the last thing here is, this data really shows we do have what you're calling a silver tsunami, but Stanford continues to grow and it's predominantly young folks. So as we get into the second phase of the community impact planning, I would love staff in the department to do a little bit more of workup on kind of the fiscal impacts, right? As we move to more of an emergency medical call system, what does that mean for city finances going forward? And are there any kind of strategic initiatives we undertake there? I know there's a lot kind of out in the ether for the time being. It would be good to kind of get a little bit of focus on that about what's possible for us in the city. I think those are all my questions. My colleagues covered the rest. Sure. Councilmember Wolbach.
Thank you. So just a quick follow-up based on the exchange you just had. It sounds like what you're doing with identified quote-unquote super users in Palo Alto is kind of that first step towards integrated, deployment, deployed medicine. Is that kind of right? And so the question now is, how do we expand upon that, make that regular, institutionalize that, and broaden it?
Yeah, I would say that's a fair assessment of what it is. We've been doing this for, probably decades. When we find somebody who is overutilizing the services, we try to minimize that because we hear from the field crews, because we're going out to the same address time after time after time after time.
And so you're then working with other medical professionals
Correct.
to identify how to prevent those calls.
Correct.
And so I think that's that might be in explaining this new thing to people. I think that's a useful touch point to say, we already do this on a certain scale, but now we're going to take what we've been doing in practice for a long time and broaden it and apply it across the board, not just to the super users, but to a broader swath of the population. But I'll let you figure out how to pitch it. But I think you're doing a great job. I think everybody here is sold.
Excellent. Thank you all so much. With that, I will move the staff recommendation.
Second.
Thank you. I don't need to speak to it, do you? Any other comments? Policy and Services recommend the council review and accept the fire department emergency medical services future needs and provide feedback. So I assume the council will be able to provide feedback if needed, and we look forward to kind of the second part, the community impact. Councilmember Holman.
So my question is that second part of it, it's like, review and accept this report or this assessment, but then it says also provide feedback and direction to move forward in exploring viable alternative service delivery models. So we've all had a number of comments, but do we need to roll those into the follow-up direction for the chief? I would think so.
Would you please include our comments in the report to council?
We will.
I don't think there were any conflicting ones.
Yeah. No, I just wanted to make sure that we got the point across that we weren't coming here asking for, a significant budgetary request, that we're not even to that point yet, but we will certainly incorporate all of your really good comments and questions into the next phase.
Right, and I think
Into the staff report that's going to council.
Correct.
Yes,
and
okay.
we will all be sure to highlight to our colleagues how important this is and that their comments and questions are encouraged. Anything else? All in favor? Aye. Thank you very much. That's 4 in favor, none against. Thank you all very much. This was an excellent work. let's move on to item number 2. This is a code enforcement audit. And I believe we should start with the staff presentation when you're all set up. And then I see we have one commenter from the public. Welcome, and if you want to kick it off when you're ready.
Good evening, Mr. Chair, members of the committee, Harriet Richardson, City Auditor, and with me is Yuki Matsuura, here to present the code enforcement audit. So we conducted this audit at the request of several council members, and Yuki is the one who conducted it, and I'm going to turn it over to her so she can talk about what she did and the audit objectives and findings and recommendations.
Thank you. My name is Yuki Matsuura. I'm a Performance Auditor 1. The first thing we did in this audit was to find out who in the city is doing what. What are they enforcing? What code are they enforcing? So this is Appendix 1 of the report. It shows that there are many city functions that are enforcing different areas of the code. And the planning department has code enforcement function, and that's often seen as the main function of the city, but it's actually just one piece of this bigger picture. And I also wanted to share this chart that we created at the beginning of the audit. Initially, we focused on enforcement action, which is the left bottom of the chart. These are what city staff do to enforce the code. When they respond to a complaint, they might issue a notice or warning. They might conduct an inspection, and they may also issue a citation. And as we gathered information, we realized that there are 3 other elements that we need to look at. One of them is regulations and penalties. So the city staff, they enforce municipal code as they're written, and they also have to consider federal and state codes. So when the code is written very clearly, it's easy for them to enforce that code. And sometimes they don't have the authority to issue a citation, then that makes it really difficult. And staff who is enforcing the code is in the best position to inform the policymakers how to change the regulation if something is not working. And top right of the chart is public awareness and prevention. You would have to inform the residents of what the code requirements are, how to report a violation, and you have to provide resource and assistance so they can meet the code. When this top right corner is done right, it should reduce the number of complaints, and it should reduce the need for enforcement action as well. And well-informed residents make detection possible. And I believe the planning department started using Palo 311 in 2016. And, but the 311 needs to be administered well as well. So all of these 4 elements have to work together to make up an effective code enforcement program. So the first question we asked was about the timeliness and effectiveness of the investigations and resolutions. And our finding was, yes, in many cases, but timeliness and effectiveness have been hampered by different factors. So the biggest one probably is the reduced staffing, especially in police and public works. That combined with reorganization made the roles and responsibility unclear. And there are difficult cases which we explained in the report. And when we asked staff, what are the challenges in code enforcement, there was a common theme, which was the municipal code itself. It's the complexity and some vague sections. And there was also the 2005 strategy that was confirmed by City Council that discouraged formal enforcement. So some staff mentioned that, well, they can't issue citation because that's the direction. And there are some regulations without enforcement program or resource. So to address those factors, we recommend that the city clarify and confirm the enforcement strategy and priorities and develop procedures that's aligned with the strategy and update the municipal code. And the second question we asked was about record keeping and reliability of data. So here our finding was, no, the city doesn't have reliable data. So the city's record-keeping system is decentralized, so that produces incomplete and inconsistent data, so you can't really put it together to provide citywide information. And also the complaint data is also not tracked. Sometimes you get phone call and you don't write it down, so that phone call is not recorded. And as a result, the city management and city council, they don't have reliable data to make policy decisions. So for finding 2, we recommend that the city identify which data to track and determine which systems to use for each code enforcement function and standardize terminology citywide so you can communicate better and design reporting processes so that you can produce citywide data. And also, the planning department uses Axela code enforcement module to capture code enforcement data. So if planning keeps doing that, then we configure the code enforcement module to better collect the data. And the third question we asked was about the communication. So for this, our finding was yes, but the information is scattered across different systems and they're on different websites, so it's hard for public to access the information. And we heard quite a few comments about Palo Alto 311. For example, the issue types are confusing and they don't always get a response from city staff. The response from city staff is hard to understand. We also heard from city staff that they don't know what other staff are doing in terms of code enforcement. So there are some internal communication issues. And because of that, the planning department's code enforcement became the go-to place for any code enforcement cases or complaints. So we looked at some other jurisdictions and found that they have information on the website in the central location of the website, so it's easier for the public to access that information. So we recommend that the city provide citywide information in the central location on their website and assign responsibility to maintain that website. And also assign staff to administer 311 centrally and provide support for staff to use 311.
So the city manager's office agreed with all of our recommendations, and I want to point out that you have an App Places memo in front of you. When we copied and pasted the response that the city manager sent us into the report, word renumbered some of the recommendations, and I didn't catch that, so this is just correcting the numbers so they align with what's in the text of the report. So that completes our presentation, and we will entertain any questions.
Thank you very much. We have one member of the public who would like to speak, Winter Dellenbach. 3 minutes good enough, Winter?
I'd like a little more since I'm the only one speaking.
How about 4?
Maybe, I just have a few points. I'm not speaking for a long time. I just like to make my points.
Please. Can you turn on your mic? Just the main button in the middle. There you go.
Okay. Oh, that's how you guys make that magic happen? God, I never really knew. First of all, Harriet, thank you for this. 3 years. I met with Harriet and asked if it wouldn't be a good time to take a look at code enforcement, since I had my experience with code enforcement led me to think that there was a good reason to take a look and see if we could see how we could improve it by taking a good hard look at it. It struck me, and I should say I left my glasses at home, so I have a hard time here. So I want to really thank you. I think you showed actual courage with this. And thank God we have a city auditor, and may we always have a city auditor. And I think this audit is very, very good. And I think it's good because of you. And thank you, Yuki, for putting your time into it. But I thank you for this. One thing about it is I know that in the past with audits generally, not just with you, but in the past, one of the problems with audits is that the, good recommendations can be made from good audits, and then as they go on, 6 months, 6 months, 6 months, and then they piddle out, and a lot of stuff gets lost in the sauce, and a lot of recommendations never get made. And it just gets lost. And I don't want this to get lost. And so one thing, I read the whole thing, and so I get to the end, and it seems like the city manager needs to set more specific corrective actions, as you progress toward the target dates, because it's all really vague. And I'm afraid that this may lead to this inevitable march toward not making very much of a meal of this. And I really think that this is an opportunity to make what is a very, very important function in this city work an awful lot better. And I think that if we blow this opportunity, what a shame, because if we don't enforce our municipal codes, you folks on city council, you sit up there and you work and you think and you try and you deliberate and you do your good work, and then if you don't see the fruition of your work, I would think that you would want this department to be working for you better. You passed the ADUs. You want code enforcement helping you have that program succeed. You don't want neighbors mad at each other because, this is being done this way or that way and it doesn't conform to the code. You want neighbors happy because that makes that program better. So you want this to function. So I make a plea to tighten these goals up, make them more specific, because they are very vague the way that all of that is written. So please do that. Okay, moving on, made that point. Another point is that when you read this whole report as a totality, I tell you this. So we had 3 staff people in planning code enforcement. We're 1/3 down. We now have 2. Thank you. We now have 2. Because James Stevens, who was hired to work on, in part, more leaf blower and to try to do inspections for planned community zoning inspections, which are to be done every 3 years, and there's 47 of them to be done, and they're not being done. He's gone. He's now working for the county. So we have 2 inspectors. Thank God for Brian Reynolds. Brian Reynolds, I hope, is getting a huge salary because he is a really good code enforcement officer. But the code enforcement's never going to work unless there's more code enforcement officers. And there's a hiring freeze. And unless this thing is staffed, it's never going to work in code enforcement. Now, there are other, of course, people doing code enforcement, but did you know there's over 500 leaf blower complaints in 2017? And do you know that there were, I think, 7 violations or 13 violations between the cops and planning? Of all of those, they found 13 violations out of more than 500 complaints. It's the biggest waste of time imaginable, unforeseen consequence of taking up time from code enforcement, just saying. So if we're going to be doing enforcement, we better have the staff. I'm probably speaking to the wind, but it's never going to work unless there's staffing, and that takes money in a hiring freeze. Moving on. The 311 Acela Building I, it is such a wreck. 311, I don't even use it. I file code enforcement complaints. I hardly ever use it. I hand deliver my stuff, or I do it through the email thing, because it's really awful. You don't get information out of it. It's clunky. You can't. Anyway, it doesn't work well. And Acela, you need to be a genius, I think, or more of a genius. Well, I'm not a genius, so I can't use Acela. I call up a friend and I say, can you check something for me on Acela? It's really hard to use, and Building I is incomplete and stuff isn't there, and the whole thing is really a mess, and you don't need 3 of them. Decide what you want and make it work, and that's what we have to do. And then confidentiality. So Redwood City, right on their code enforcement website, states that the complainant's identity is kept confidential. And it states that, and it means that, I guess. And that's how it should be here. My confidentiality was breached, unfortunately, to somebody who has a past of the most serious, a very serious, violent past. Of somebody that I filed a complaint on, a very serious violent past. I did not like that. I don't know how it was breached, but it was. And somebody else very well known in the community, his confidentiality was breached when he filed a complaint. Complainants' identity should be confidential, and people should be told it's confidential. I'm almost done. Recidivism. I just filed a complaint on the very same thing I filed a complaint on just a little over a year ago. Ironclad evidence, absolutely ironclad. They converted a garage to an office, did the same thing again, same people, same office, ironclad evidence. It's not preponderance of the evidence, it's beyond a reasonable doubt. It'll get checked out. And it shouldn't be like it's a brand new case. They should be issued a citation. They should get a fine. But it won't be. They'll be told, convert it back to a garage. And as soon as code enforcement steps away, they'll convert it back to an office. And the next time they do it, then they'll be told, hey, don't do this anymore. It's the most ridiculous thing, because you don't issue citations, even with ironclad evidence. It's just, don't do it anymore. Would you please issue citations? And I think I'm done.
Can I ask you to please wrap up your
Yes,
comments?
okay.
Thank you.
Thank you. I wrap up my comments. I'm done. That's it.
Excellent. Well, good timing.
See, I know. Came in right under the wire. Oh, yeah. Thank you. Thank you for allowing that.
You're welcome. All right, let's return to council and just a few quick comments. So the recommendation is that we recommend this audit to the city council. So I'll wait for one of my colleagues to make that. I'm sure they have some questions. I do just want to note, thank you very much for this audit. It's super helpful. I think it does respond to a lot of community concerns. I will note, it seems from my review of this that most of our code enforcement issues are resolved or confirmed or dealt with. But I think the big issue is kind of the feedback cycle and the integration across different city departments. And so I would encourage us to kind of focus on that side of it. It doesn't seem to me like the sky is falling. There are some gaps that we have here in the city, and it would be great to address those, and I think there's a lot of good recommendations in here. Let me open it up to my colleagues, council. Oh, Mr.
If I might,
Please.
yes, thank you. Chair, members of the committee, thought it might be helpful just to provide an administration perspective on this, and actually may hand it off to Michelle if there are comments she'd like to add. And in fact, since I made reference there, Michelle Flaherty, Deputy City Manager, has been coordinating the review and follow-up to the audit. And let me add to Winter's comments and say thank you, and council members' comments as well. Thank you to the city auditor. I do believe that this is good work and important work to review and provide the level of detail in an evaluation of where we currently are as we are turning the page and looking forward to where we can make improvements in the system. I particularly found interesting the timeline and the code enforcement timeline that described how organizationally there had been moves over the course really of more than 2 decades among responsibilities among the various departments that have been involved, not only planning and community environment, but the police department, in some cases public works, and community services in order to address these issues. So I think it's fair to say that this is a situation, just in terms of how we've dealt with code issues, that has developed a great deal of complexity, and perhaps not unlike many things in Palo Alto, built up over time. And so the follow-up, and both in the administration response as well as the work that we see ahead, will take some time also to work with the council and obviously with the departments and community to identify where the issues that need some clarification are in terms of definitions of the priority issues for quote-unquote code enforcement, and what definitionally would be the providing the greatest return on investment for the taxpayers' investment in staffing, and how we can best ensure that issues are addressed both in a timely manner as well as focused on those that really do require regulatory response, rather than simply, again, kind of working with the parties involved. The work plan that we see ahead is a really substantial one, in that it will require updates to Palo Alto 311, as has been described, in addition to looking at how other integration is effective and worth pursuing with other technology systems, but more importantly, it's the handoffs among departments and how that can be facilitated with tools rather than relying on manual processes that often are, unfortunately, are where we stand in dealing with things today. So I do expect that we will be able to provide updates on an ongoing basis going forward, so look forward to doing that. I know that as Michelle and I have talked about this to date, we don't want to overpromise in terms of how simple the work ahead will be, because again, anything that has taken this long to create the installed base, as they say, will take some time to unwind and, again, to set some priorities with the council. So with that, let me ask Michelle if there are other comments that she wants to make before we turn it back to committee for your discussion.
Thank you, Ed. I would just add, as a follow-up to Ms. Dellenbach's comments, I thought she raised a really good question, which is, gee, the timeframes as included in the report seem pretty wide and vague, and she's right, they are, and they're that way for a reason. I need to get in and start working with an interdepartmental team to start to break this down and develop a much more refined work plan on this. And rather than trying to, as Ed described, overpromise and underdeliver, or sort of second guess everything that we're going to take apart when we get in, we wanted to be more transparent in our reporting. And so we've got broad horizons here with the understanding that the first step is developing a much more detailed work plan and reporting back to the committee on a regular basis on our progress toward that.
And on that point, recognize that we'll be working with the staff that are actually doing the code enforcement, as well as overseeing, not the least of which is our Planning and Community Environment Department Director, which we will hopefully be able to fill shortly. But again, we're not adding staff for the purpose of the evaluation. These will be evaluating while doing. So we'll need to continue that in parallel.
Thank you very much for that context. I'm going to turn it over to my colleagues in just a moment. Just one comment, it is 7:15 and we do have one more big item tonight, so if we can be a little quick on this, and it will be going to council as well, that'd be helpful. Councilmember Holman.
I'll be as quick as possible. We've been waiting for this a very long time, and I do have a number of comments and questions. First of all, thank you to Harriet and Yuki for bringing this forward and completing this. I appreciate the comments from City Manager Shikata and Michelle Flaherty to about how this might be implemented. So I have some kind of basic questions. One is in the audit, and I read, got marks throughout here. Seemed like there are two different terms used, closed and completed. And I really don't know what either one means, because I've been shown complaints that have been filed and they show up then as closed or completed, I don't remember which, but they're still ongoing. So it gives someone the sense, and this is kind of like the systems being broken, so but so that's one, the terminology needs to be standardized.
Sure. You've picked up on one of the first bugaboos that I landed on when I started looking into this.
We'll have a drink later.
And I think one of the catch-22s we sometimes create when we are trying to get better at process improvement is we start bringing in things like performance metrics. And I think we've had a breakdown between well-intentioned efforts and unintended consequences. So as I understand it, in the 311 system, when a resident puts in a report of a concern, and then that gets sent to a particular department to act on, in many departments what will happen is they will take that information out of the 311 system and put it in the software that that particular department uses for internal casework tracking, which, by the way, is not a citywide system, so different departments are using different systems, which is part of our problem.
Mm-hmm.
And as they put it in that new system, they're going to do all their future tracking in that system. And then they hit the close button on the 311 case, which unfortunately can signal to the resident or the complainant that their situation is, it sounds like, resolved, when in fact it's just been assigned. So it's a really good example of staff who are sort of down in the weeds trying to get stuff done, not having visibility into the communication consequences of what's happening with the other hand. And it's one of the things we want to fix. One of the things that I thought the auditor's office did a really nice job in this report is drawing the nexus between how the work behind the scenes gets done by the staff and how we're communicating successfully or unsuccessfully to the public about what we're getting done and when we're getting it done. And well-intentioned as we may be, the system isn't working the way it's currently structured. So one of the things we're doing is we just talked about this with our executive leadership team last week and talked about asking everybody to stop closing it when it's not resolved, and that communicating the status updates to the complainants needs to be done more proactively. And the first step in doing that is not cleaning up the data by closing it in one system when you open it in the other system, because it's not communicating the real status effectively. So it's a common sense solution, but getting every department to follow it consistently takes a little internal communication effort. So we're working on that now.
Okay, good. I will try. I do have a number of questions and comments. I'll try to go through these fairly quickly as is feasible, and won't expect an in-depth response on every one of them, but I hope that these will be captured as this goes forward. it's, I was thinking, when I was reading through this, I was thinking like, rather than saying, I had two responses. One is, this is as broken as our business registry. And the other is, boy, it's a really great opportunity for somebody to be a heroine or hero. So kind of both things are there. On page 1 of the report, I don't know what packet page it is, I tried to do it from the report, but on page 1 of the report, it talks about staff complaints. There seems to be, depending on who you ask, staff either makes complaints or staff doesn't make complaints. This says that staff can make complaints, and I don't expect staff to be walking around the community, on alert and on the job all the time, but there are things that we all walk by downtown that are very blatant violations, and they just never get reported. And staff has to walk by them many, many times. I won't name any, see me later. Construction noise on page 22, a few things on that. One is there's construction noise, and then there's ongoing noise. And I have heard for a very, very long time, most especially, but not solely, related to the Stanford Research Park, that there are chillers on roofs that just go all the time, and at night especially are very noisy, and when or if the police come out, they say, well, we don't have any way to measure the noise. And I've heard that more than once. That seems kind of crazy to me. I mean, you can buy an app for your phone that measures decibels, so I don't understand that. Recidivism, the speaker mentioned that too. I think we all know of projects that just, and operators, whatever you want to call them, just have the same violations repeatedly and repeatedly and repeatedly. And I don't know about this thing on slide 4 that says the 2005 strategy discourages formal enforcement, and so can't issue citations. I'm not sure about that. I'm not sure I've known of much of anybody who's ever been issued a citation. And I think especially when in the case of recidivism, it seems like it would be really appropriate. I mean, we want to get concurrence, but I've said before, it seems like that the city subsidizes repeat violators because we send staff out again and again and again, and we don't get any. Harriet, you want to say something to this?
So that was one of the issues that we addressed fairly extensively through the audit. We asked a lot of questions about it, and we consistently got the response that they treat each case, once a case has been closed, the same person violates, they treat it as a new case. So the municipal fee schedule does allow increased fines for each violation of the same type by the same violator within a 36-month period, but that is not the approach that's being used. It is being treated as a new one. So then they wait their 5 days before they would issue a notice that they might issue a citation, but that's why the citations aren't being issued.
And that seems nonsensical to me. It really seems it really does seem like the city is subsidizing these repeat violators, and I appreciate the nod of the head, Michelle. While I'm on that one, just a quick mention here is like there was a stalled construction project. There are a few of them around town, but there's one where the fines that could have been assessed on that project were waived in order to try to get concurrence to get the project get rolling. I just don't understand that. I just don't understand it. I mean, there are other ways to get compliance. I don't understand we waived. This is like, it was over $100,000 in penalties, and we just waived it. I don't understand that at all. I appreciate the not wanting to overpromise. I appreciate city manager commenting on that. You've already been elevated to city manager, not acting or interim. You're already city manager. I appreciate the thing about not overpromising. That said, I would rather have some kind of check-ins that rather than like every 6 months when the audits come to the Policy and Procedures Committee, just seeing a column that says "in process." Because that's what we usually get, and that's just really not productive, not helpful, not informative, and doesn't help move things along. So this one I actually would like, it looks like you, Michelle, to respond to, like how we don't overpromise, but have some kind of accountability and some real progress reports that can come with the audit reports.
Sure, I'd be happy to commit to more substantive progress reports. What I wanted to make clear was we don't have the full detailed work plan completed yet, because we want to get in and start the initiative to develop the more detailed work plan. And once we have that and we start acting on it, we can provide something much more specific than just in progress. We'd be happy to provide detailed updates.
Okay, all right, that sounds like a commitment. So, okay, good. I also forgot my glasses tonight. Oh, yeah, the different reporting systems. Somewhere in the recommendation, or some places in the recommendations, it talks about if, 311, blah, 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 blah. But then other places it seems to like not differentiate or indicate that we needed to hone down to 1 or to 2. So that was confusing to me, and maybe that's a question for Harriet. Is there a thought that the city staff should be looking at, we go down to 1 reporting system or 2 reporting systems, or how they interface? That didn't seem clear to me in the recommendations.
So we know that the police department, because of some Department of Justice requirements, has to keep some things in a different way, and so that may not be able to be fully integrated. But we also know that the other departments, with the new ERP system, we know that there's also a possibility that there could be a code enforcement module, and so we didn't want to commit to saying fix 311 if the city were to decide to use something else. So that's part of why we left it a little bit vague like that.
And that was actually one of my questions. It's like the record keeping, I didn't know if ERP might potentially have a way of doing this record keeping.
And we don't know yet because we haven't made a final decision yet on ERP.
Okay. And that's, I would think, something high on your list. Looks like you're going to be the lead on this, is what it is. So that's something that would be high on the list. The confidentiality thing, which is mentioned, I'm also aware of somebody whose confidentiality was violated. That's actually central. It's not determined, I'm sure this will be going forward, but how many staff are actually needed to do code enforcement, even just with the planning and building departments. I imagine that'll be partly discovery, but what do other cities have for our population and daytime population as well as nighttime population? How many staffers do they have? What's their approach? Hang on a second, page 49.
Councilmember, I really would, caution at that point with benchmarking. Again, I think we have shown through the audit that we currently have staff assigned to activities that other cities would not consider code enforcement. And so the level of effort involved in enforcing the rules really do need to be modulated. So this is work ahead, and it's work not, quite frankly, that can be handed off to staff. This is one that needs to be interactive between the council and staff to identify both what level of enforcement as well as what level of resources need to be put into these activities going forward. I want to jump in there because if the assumption is we're just going to fix it as staff, it's not going to happen. You have my commitment. This is a priority. I personally have been involved in responding to constituent requests since the day I got here, and Michelle and Rob have taken that on as well. And we recognize the importance of responding to the individual citizen requests that the city received, probably as much as anyone within the city. So you have our commitment that we will vigorously see this through. That said, the systems that we take on, and whether it's a new system or what it's integrated with, we really do need the flexibility to work it, because we don't want to create a new problem by trying to have a system that attempts to do too much. So that said, I'll relinquish, but nonetheless want to make sure that it's clear.
Well, don't misunderstand, I was trying to say that one of the first things is to determine how many people you need, because that's not one of the first things that would be identified. On page 49 of the report, it's talking about planning and building both, or development services and building both. And something that I didn't see particularly highlighted here is there are times when, well, it says that, compliance takes a long time because getting permits takes a long time, blah, 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 blah. In the meantime, if there's somebody occupying a building, and I know of several instances where this has happened, in the meantime, if there's somebody who's occupying a building, some entity occupying a building without a permit, and while they're looking to get a permit, they're still occupying the building, we don't have good record also with our occupancy permits, and without the business registry being very functional, we have entities occupying buildings that have never been inspected by the fire department. And so there's not a, hey, you got to get out of here until you get a permit. I don't ever hear of that happening. That's say it doesn't, but I don't ever hear of it happening. It seems like people just continue to occupy in uninspected situations. And I'm getting fairly close here. Thank you for your difference, but this has been a long time coming, and hang on here a second. 6:13. I covered those. Okay. Okay. There was a comment made about, it looks like, I think I've covered those in my other comments. There was a comment made that it looks like we solve or satisfy most of the code enforcement complaints. And I guess I'm not quite confident how that's determined because, again, of the closed and completed and just things that I see on the ground that don't seem to be taken care of. I don't know how we know really how many are closed, or whatever term you want to use.
So that's the data piece. We didn't have the complete data to be able to assess that from the data. But looking at the cases in detail, we saw that there are a lot of cases being resolved. It's just the timeliness may not be there because some cases, they don't get to it right away. So the timeliness is an issue, but we just simply didn't have the data to be able to assess that.
Yeah, I just don't want us to, and I'm not trying to be critical here, I'm just trying to be realistic. It's like, are we really solving that many and resolving that many code enforcement complaints or not? And I just don't want us to make an assumption one way or the other, because I don't think we know. I don't think we absolutely know.
I'd also like to make a comment specifically about the leaf blower cases with regard to that. So a large number of these cases are the leaf blower cases, and they go out, they do an initial inspection, and then about a week later, a week after, trying to kind of align it with timing of when they think that the operator might be there, they do another inspection, and when they don't see anything, they close it. So that may look like something's been resolved when they haven't really been able to determine if there was a violation or not.
Thank you. And then I think my last one is there are some things that are timely. And I think of, city manager knows about this, tree situations. There've been tree situations on my block, and one was rather urgent and another one wasn't so urgent but still isn't resolved. And so if there's a way to prioritize those that really need, if someone is digging at the base of a protected tree, for instance, or using heavy equipment at the base of a protected tree, that isn't something that can wait 4 days to get a response. It's a real-time kind of thing. So I think prioritization of the types of responses and code enforcement issues is also very, very important. So I think that covers my comments. Thank you for your patience, but I've been waiting for this for a very long time, as many of us have, and I'm very happy that it's in front of us, and look forward to some resolution so I can be a member of the public and say, hey, that's taken care of. So, thank you all. Thank you. Thank you.
Councilmember Du Bois.
Yes, our future code violation reporter. So I think it's a great example of using an audit to highlight issues, right? I mean, like Ed said, this is built up over a number of years, and it's a good chance to say, how can we do some of these things better? So I'd echo several of Karen's comments. So Harriet, how long did this audit take?
It took about 1.5 years. And there was a lot of coordination involved with this, with the multiple departments, and also seeing where one department would tell us one thing and another department would tell us something else, and going back and saying, but they said, and they said, nope, this is the way it is, and then going back to the other one saying, but they said, and then getting everyone together trying to resolve it. There was a lot of that back and forth that took a lot of time that we didn't anticipate when we started this.
Yeah, I think I read in the press it was 1.5 years. And I don't know, Yuki, do you have anything to add? What were other challenges?
So I think majority of the work was done by March, April. And then I think the coordination, again, the meeting with departments to make sure that what we found was right. So that took a lot of time.
I think some financial analysis would be useful. So I think understanding potential savings from the way we do enforcement now to if we did it more efficiently. And kind of what's the long-term cost of not enforcing? I think that would have been an interesting addition to the audit. Obviously there's potential revenue from penalties, but I think the bigger savings could be from just a more well-run city, more consistent policies, if fewer violations. Once people know you're enforcing, it probably reinforces itself.
I think some of that comes from a change in policy where the strategy is to achieve compliance, and that is consistent with what we found other jurisdictions do, try to get compliance before issuing a citation with a fine. So it would be, I think, clarifying when do you issue a citation and how much time do you give them, and if they're working toward enforcement, do they have a reasonable amount of time, and where do you reach a point where you say, okay, enough is enough, and now we're going to fine you.
So I think it's important to step back and say, why are we even talking about court enforcement? So I think it's a pretty critical issue. I think it goes kind of to the heart of our social contract as a government. And I think our national citizen surveys have shown, decreasing trust in government. And I think this has to be a factor. And, anecdotally, I hear from residents about kind of scofflaws and people knowing that people are getting away with stuff. And I heard a lot about it during the campaign, a lot of different situations. So I really think it's critical that we address it, and I appreciate the city manager saying that, it's a priority. And it goes to the issue of fairness, right? I mean, people want a level playing field, and if they feel like other people aren't following the rules, it's temptation for them not to do the same. So, and, we talk about these 2 or 3 heads in code enforcement, but I think the audit was useful to point out all the departments it touches. I mean, we really have many more people involved, but the areas are pretty widespread too, right? So there's unpermitted construction, there's people blocking sidewalks, leaf blowers, noise, short-term rentals. I mean, there's a huge array of things that we're talking about. But just stepping back again, I think the underlying thing is we need to have a level playing field and have people feel like we're enforcing these things. And so that's where I would start, and if it needs to come to council, but I really think we should set a clear policy on code enforcement, being a priority. So I don't necessarily agree that most of them have been resolved. I think, and again, maybe it's anecdotal, but we hear about persistent or repeat offenders. I kind of expect that the 80-20 rule is going to hold, and hopefully we could get 80% of the issues resolved fairly quickly. And then we could evaluate how much time and effort is it for the rest of it. But I would say, I think Karen's idea of maybe coming back with a status report's a good one that, don't hold off if there are some easy wins, right? And I think one area that seems on the surface to be an easy win would be this issue of repeat offenders and doing some kind of code cleanup, maybe bring that to council. And there was a letter from the public. I think it had some interesting ideas about considering time limits to fix something, as well as maybe escalating penalties. But this idea that a repeat offender starts over as a first-time offender, that seems to be broken. In terms of the systems, leave that to staff to figure out. I do wonder if, given where we are, we should maybe continue just shutting down 311 and replacing it with ERP or something else. I mean, I wouldn't necessarily just continue it because it's there. It kind of feels like we made this app, but we didn't really think about supporting it over the long term, so maybe it's better to just start fresh with something else. And then I do think metrics are really important to incentivize the right behavior, and kind of like the previous meeting, we were talking about measuring outcomes. I think that's going to be the most important thing, rather than, time to close the ticket and it's not really resolved. So really kind of measuring resolutions. And then I do think communication is a big part of this, and that a lot of the frustration has been, I think, on both sides. I think public was frustrated not knowing what's happening. I'm sure staff gets frustrated. Maybe they hit a situation they can't really resolve, so they just don't want to respond to that member of the public because they don't have something good to say. So I think, fixing the communication will be important. And then I just want to end again with my first point, which is I really do think, and it might help prioritize this, that we could show substantial cost savings and potentially for multiple sources by doing this better. It's not just a good thing to do and shouldn't be looked at as like a work project, but I actually think it's part of an efficient city. Could potentially pay for itself if you really captured kind of the cost recovery aspects. I could include, avoiding a lawsuit if there's a failure to respond to something that was reported. There could be a lot of ways that we save money doing this. So I know Corey hasn't spoken yet, but I was going to go ahead and make the motion if Corey wants to speak after that. But I would move the staff report with the addition that you would come back with a work plan and progress report as early as possible next year to P&S. Yeah. Okay, thank you.
All right, so we have a motion on the floor. Do you want to speak, Karen?
Just one, was going to add an amendment that they also incorporate our comments this evening and respond to those. Is that agreeable?
Yes.
Okay,
Councilmember
that was
Walbach?
accepted.
Want to say, I think that the big takeaway here is that there is a lot of good work happening in the city when it comes to code enforcement. There's a lot of hard work that's going on in the city organization when it comes to code enforcement. Now we want that work to be better organized, tracked, and efficient. That's how I sum up this whole thing, looking at it as a council member. It's like the line staff is doing a lot of great work, and now having this leadership in the city manager's office and the auditors, supported by the great work that you've done. Thank you, Yuki and Harriet, for this. It's really highlighted where the challenges are, and I think the path forward. Just a couple of things that I'll add based on the conversation that we've heard. I think that we should track repeat code violators and track that accordingly, moving beyond just repeated warnings when necessary. Also, when it comes to 311, I would not suggest trashing 311. There's as was pointed out, great opportunities for improvement there. And I also hear from a lot of residents who love 311. They think it's great. For them, it works, right? Now we want to make sure it works for more residents, or that if there are other, if people are using, as Winter pointed out, people are using other mechanisms to report code violations, that they're still being filtered into ultimately, however, whether you're calling it in, you're emailing city staff directly, emailing a council member who forwards it, or using 311 on your computer or on your phone, however you're delivering the message to the city that you think there's a code violation, that it is being centralized and tracked in a central, cohesive manner. I think that's really the point. But a lot of people really do appreciate having 311, despite its opportunities for improvement. So I just wanted to make sure that that was noted, and I'll support the motion.
All right, so just a couple quick and final comments. Thank you very much for this. I think it's really thorough and helpful to the city and our residents. A few quick comments. Also, like Councilmember Wolbach, I'm happy with 311. I personally use it. And Winter, to your comment about how you submit your code enforcement complaints in person, I didn't even know we could do that because I've only used 311. So there we go. Sweet. Councilmember Du Bois touched on the issue of kind of, I guess, cost recovery per code violation. I'd also love to know kind of our cost per enforcement, especially with something like, gas leaf blowers, right? If we're sending it off, if we get a violation, we send somebody out and we send up a follow-up, like how much is that actually costing us and how few of those are we actually executing on? And I think that can kind of raise to the council level, where do we focus our limited resources? And then it also kind of gets into my point about, and this kind of harkens, I guess, to the work plan that will come back to us at some point, what management decisions do we want to make via this audit and on code enforcement in general? I think it's easy for each of us to say, every code violation should be enforced fully. I don't think that's completely realistic, and so we should be kind of thinking about what are the priorities and guidelines of how we do that, whether it is, recidivism or repeat offenders or the most egregious code violations. We at a council level kind of need to make a decision around that management there. And then the final piece, just looking over this, it seems like the two big problems I kind of got away from this audit are, one, there are multiple sources where they're reported and executed on across different departments. That's probably kind of a longer term effort to fix. The second one was kind of the feedback mechanism, whether members of the public can see if a violation has been made or whether their specific violation has been fulfilled. And I saw that as kind of the easiest place for us to execute on quickly. And so whether it is putting it up on the city website or increasing our response time to residents on, your violation was filed, we followed up on it, and X happened. I think that's kind of the shortest term solution, and that really addresses kind of the citizen satisfaction piece, right? I don't think people expect every single code violation to result in a fine or the issue being rectified completely, but I do think people expect a response. And so if we're missing out on that, I think that's a huge issue of satisfaction, quality of life that people would really appreciate, and I think in the work plan should probably be prioritized. I think that's about all my comments for now. So if there's nothing else, thank you all very much. Everyone ready? All those in favor? Thank you. That's 4 in support, none against. And just to recap, the motion was adopt or recommend the audit, do a work plan as soon as possible, and come back. Was it P&S or council?
Come back to P&S with the work plan.
Okay. And take note of our comments. Awesome.
With response to our comments, too.
With response to our comments,
Yeah.
Thank you. Let's take a quick 5-minute break if that's okay, and then we'll get back to the last one. 7:50, if clerk needs it. All right, it is 7:58. I'm going to call back to order this meeting of Policy and Services. We're on to item number 3, a recommendation that Policy and Services review the council procedures and protocols and recommend revisions for staff to incorporate and return to the committee for further review. Rob, do you have any comments to kick us off?
Just to kick things off, Rob Goes from the City Manager's Office. So looking forward to your comments this evening. What's in your packet is really the last, as I tried to untangle when this was really looked at last time in a thorough way, or I don't know if I can say fully thoroughly, but it was back in 2015. It did go to Policy and Services Committee twice in that year, and so included in the packet the comments related to the feedback from the committee at that time and the minutes related to that. Also in the packet is the staff report from October 29th, just recently, where we brought forward an ordinance to make some necessary amendments that relate to council going from 9 members to 7 members and the different number of people that can be on a committee and that type of thing, and that was approved. And then also in your packet is the most recent comments from council members since October 29th on how the document might be improved, and we heard from Councilmember Fine, Koo, and Holman on that, and that's at the very end of the book that you have for today. So I thought on discussing today, staff recommends that we hear the comments from the committee and any public comments if there are any, and then staff take it some time to actually review and do a new draft of the procedures and protocols. We think it's probably best that it come back in the new year when the new council is seated. For a number of reasons, we do think that it does need some work for a variety of reasons, not the least of which we do want to hear from the council comments and understand them and include them. We know the city attorney will have some additional feedback and comments, and the city manager, and we have a new city manager coming in, also will have some sort of administrative comments about the procedures and protocols. And also my initial review, and I've looked at 10 other procedures and protocols that councils have, and they do vary quite a lot, and there's a number of things that council might want to include that are not included at this time. And lastly, I think any changes that we do make to the procedures and the protocols will impact the new 7-member council next year, so it seems like they ought to have some input on what ultimately is recommended by the council. So with that, as an introduction, I don't know if the city manager or incoming city manager would like to say anything, or Chair Fine.
So I was actually just noting we have our city manager, our incoming city manager, our city clerk, and our city attorney, and this kind of touches on all of you. So I'd love to hear from all 4 of you if you'd like to speak up before we bring it back to council. Oh, and yeah, Janati, what procedures do you want to see? So any order you all choose.
Maybe we'll go back and forth. Janati's been fond of commenting on who I quote at times, and so I would just sort of say Bob Dylan famously said once, an artist must be in a constant state of becoming. That sort of is like our procedures and protocols. They're sort of in a constant state of becoming, or certainly not completion. And I would say a couple things just as far as background. We've often had some long discussions, as I recall in the past over the years, sometimes getting into a lot of wordsmithing about language. I think, Beth, you can help out for whatever reasons. Whatever we sort of did the last time, I'm not sure all of it ever made it fully into, formally adopted. And, even in the, I think that was back in 2015, right? So even in that intervening period, there would be occasion that things would come up, and I would talk with Beth or with the city attorney at times saying, well, what's our policy? Well, our old policy was this, our recommended policy but not adopted policy is this, and we try to sort of articulate, what we should follow. That being said, they're fairly, I would say in my experience, they're very Palo Alto in that they're much more detailed than most other jurisdictions I've ever worked in as far as the policies. And one thing I do think we need to really keep in mind is clarity about actually how we act on them and, once adopted, how we actually, I'll say, enforce them. I think our language sort of, we have some language in the thing that basically sort of says that it's sort of up to the council or the council members to sort of self-police or self-regulate, right? But I would say we haven't necessarily always just sort of followed our protocols either, or we don't necessarily have good options for how to have an ongoing conversation back with the council, whether it's the chair of a committee, the council as a whole, about how things are doing. We do this annual review, and I would just suggest we stay open to that. I would pile on, though, just a little bit that whatever we do tonight are going to be changes, right, that ultimately have got to be adopted by the council. And I would just echo what Rob had surfaced, is that we will have a different council, or you will have a different council next year. It will be smaller, and it will be different. It will be different because it's smaller and it's different people. And these are guidelines that, in many ways, I mean, clearly are going to guide that particular council. And so I think the committee does need to think about how you surface ideas or perspectives that might be worthwhile for consideration. But I would caution you about thinking about pushing for any sort of implementation with this council. Just food for thought.
I think there are a number of issues for you to talk about. Hello. I think there are a number of issues for you to talk about. The different size of the council, I think, is something that bears some real thought about how that will affect the body, and it may be that that is something that we learn about once we're really in and doing that work with that smaller body. From my perspective, I think there's a value in council being as clear as possible about the expectations that it wants to impose on itself, because we do have a tendency to use language that can be open to perspective and judgment, and then it becomes a question of who decides. And I think to the extent that council can be clear, these are essentially, they're not laws, they are self-imposed kind of behavior expectations and rules that the council is wanting to impose upon itself. And the council itself is really the body to interpret and apply those. So as much clarity as possible would be, I think, quite helpful to the body over time. Thanks.
Okay. So just to put a feather in this, whatever the phrase is, first of all, I do want to emphasize to each of us that this is most likely to come back in the new year with the new council, and I think it's fair that that council kind of decide how those 9 to 7 issues work and some of the other changes we're making. 2, I hope you all did go through the 2015 revisions and kind of look at what they're doing and what the thrust was on that. And then kind of more philosophically, this really is, there's 2 big things I was kind of thinking about going over this. One is there's this tension between the efficiency of the council and getting the city's business done on behalf of our residents, and then also engaging those residents, right, where it's helpful, where it can be unhelpful, and how that contributes to our decision making. So that's one tension. The other one is that these are guidelines, and it is up to us to live by them and enforce them so that we have a more effective and good working council relationship. And then finally, there are large staff impacts from this, right? So how we conduct our behavior on council, how we make motions, how we direct staff to do things, whether it's adding a work plan to something or a colleague's memo on X or directing staff to take an item off consent, can have very large staff impacts that I don't think all of us are always completely aware of. And I think that's important to keep in mind. As you may have seen in the comments from each of us, Councilmember Holman, myself, and Councilmember Koo had a whole lot of ideas about what we'd like to see change. Some of them are broad, some of them are pretty specific. What I'm going to encourage us to do tonight is focus on the staff recommendation, which is to roughly, revise this document. And I think the Assistant City Manager, incoming City Manager, has made some good comments in the staff report that our protocols are focused on community-to-council interactions and the procedures are council-to-council interactions. And it may behoove us to begin separating those out and slimming this document down so it's a little more efficient, a bit more usable. I will note over my 2 years on council, I've certainly been impressed, for example, by Councilmember Holman and Councilmember Scharf, who have a lot of experience with this, when they cite or use a rule and can, shift the movement of a meeting. And I think sometimes that's been super helpful. But if this framework is more understandable to every council member, I think that's a good thing. And the only other thing I'll probably add on once we get to motions is maybe direction to next year's council or the mayor and vice mayor to evaluate our standing committees and regional assignments. As we shrink from 9 to 7, I think there's going to be increased burden on the future council and councils after that to attend, participate, and report back on our regional assignments. I think that's really important to evaluate. I have a whole lot of comments, but given that, I kind of want to just kick it off to general council questions, comments. Councilmember Wolbach.
You know, I think if we had managed to get this on the agenda earlier in the year, I'd want to do the deep dive, you know, kind of line editing thing. But I think I'm going to hold off on that, and we probably all should hold off on that tonight. I don't want us to try and do a constitutional convention tonight.
Is the sun rising? Or is
but I think that there are some really important things that we should focus on tonight. I think that the idea of, at a high level, making recommendations to the new council makes sense. I want to make, where we can, really clear recommendations. I'm not going to be here next year. Councilmember Holman won't be here next year. Councilmember Scharf won't be here next year. We will have Councilmember Cormack joining the City Council. Ultimately, if we make final detailed changes, the new council can change them anyway, and given staff availability and capacity between now and the start of the year, I think it's asking a lot to do all of this, and then have the new council maybe say, we don't like it anyway. After, if we're trying to finalize something and pass it before December 17th, but I do think, again, we should make some recommendations, especially on those areas which are, the most critical, and including a couple that are controversial. But I think we could probably find a accommodation of the range of opinions about them. I think, the time for speakers, public commenters, during agenda items is a really critical one we should tackle tonight. Make a clear recommendation. Hopefully, I think we can come to a consensus agreement on that one. The issues around, how many members does it take to pull something from consent, and a couple other items where we might want to offer, maybe not the word-for-word recommendation, but guidance to staff to clarify our protocols and procedures around calling in when a council member is remote. Updating that, clarifying that. When do we allow it? Should we discourage it? How do we encourage or discourage it? But just getting that up to date and clarified, I think, is going to be useful. What we do with items late in the evening, right? We have, a guideline that we don't really follow very well about after 10 o'clock, after 10:30, taking a vote. Do we want to change that, or do we just want to say, yeah, we want to keep that and maybe actually follow it, right? Where we want to do a check-in at 10 o'clock, do a check-in at 10:30 and ask ourselves vocally, publicly, explicitly at 10:30, are we sure we really want to take up a new major agenda item at that time of night? Or do we want to schedule a special meeting to cover an item? And then I think, Chair Fine, I think you mentioned this question of assignments. We have, I think staff mentioned it, we have a lot of assignments, and there will be fewer council members to share the load of all those assignments. My own take is that I think that at the start of each year, I think our protocols and procedures should probably recommend or stipulate that at the start of each year, the mayor and the vice mayor and senior city staff, city manager, sit down, and with city clerk maybe go through all the various assignments, see if there's any to add or to drop that are no longer, for bodies that don't exist anymore or don't meet regularly, and prioritize them, and to clarify, some of our assignments, the expectation is and should be very clear. You're expected to go all the time. Others, you're expected to be available if the body invites you, or if the mayor or the city manager, you realize, hey, we've got to have somebody there at that meeting. Others, I think like Palo Housing, for instance, they're one where they invite, whoever the liaison is once a year, and they're available for conversations and check-ins, but it's not necessary always to be there for, it's for all of their meetings. So I'm happy to try a motion on those. Happy to share my thoughts about each of them, but those are kind of, where I think we ought to focus. And I actually like the idea of having, not to gut it, not to necessarily totally rewrite it, but to have staff take a little time, over the break or start of the year, or between now and the start of the year, to put together a draft, maybe starting with the 2015 revisions, which I guess we never adopted, but I think we were really on the right track. I think Councilmember Du Bois, you and I were both on policy and services that year, and I hadn't realized I'd almost forgotten that we had never adopted it. So, yeah, and so I think starting there, but as was raised earlier, I think we want this document or this document or this pair of documents to be really useful, to be accessible, understandable, and useful for the entire council, and also accessible and understandable to the public as well, particularly those portions which give guidance to the public who are, maybe coming to their first council meeting ever and trying to figure out how do they engage effectively at a council meeting and understand how council meetings operate. So I'll just mention a couple other thoughts specifically on speaker time. I think that it was Councilmember Fine included what they do in Fremont, where if it's a smaller number of speakers, 3 minutes. If it's a larger number of speakers, 2 minutes. And if there's a tremendously large number of speakers, then maybe with discretion of the chair of whatever meeting it is, not to be less than 1 or 2 minutes. And I think we ought to be actually encouraging people when it's a really large number of speakers, often coming as a group or in groups. I think we should actually encourage them to pool their speaking behind somebody who can be kind of a spokesperson, rather than jumping from one speaker to the next, each trying to squeeze something into a minute or two, to have a spokesperson for a group. So I've got a couple ideas about how we could encourage people to do that, and I think we generally see better, more substantive and more useful comments when people do that and follow that tool. But I'm happy to make a motion, but I kind of want to let others weigh in first as well.
Thank you. Councilmember Du Bois, next.
Yeah, so just to be clear, we never adopted anything in this October 2015? Wow. All right, that's disappointing. Yeah, so like Councilor Wolbeck said, we spent, I think, 2 whole meetings. We went through it kind of line by line with comments, and I think there is some good work in there, so I would suggest we maybe go back to that and start with the redlined version. Yeah. So maybe for tonight, like what the goal for tonight, I mean, I don't know not quite sure what we're trying to accomplish. I would suggest maybe we have a fairly open-ended list of issues that would be revisited and maybe kind of treat it more like a study session tonight. Then perhaps we do two quick rounds because I think we'll probably trigger things. I'm glad it was called out here. For me, one of the biggest issues going from 9 to 7 is 37 boards and commissions that council members are on. And I think we want to be regionally heard and we want to participate in regional boards. I think we need to maintain a city presence on a lot of our local boards. So I think we may want to consider whether council would appoint people maybe for some of the local boards that aren't council members as kind of an additional thing for citizens. Things like community child care, Palo Alto housing, and perhaps others. But I do think we're going to need to figure it out. And obviously we're going to be in motion when we figure it out next year. In 2015, we did spend a lot of time talking about being able to call into meetings, and I think there were some good changes there. I don't know if we've been operating under those rules or we've been operating under the old rules. So we never adopted it, but we are doing some of the new rules. Okay. you guys figure out which ones to use, just like
Neither here nor there.
yeah.
I think that was particular that council had a shared expectation. I think on that one was pretty clear that council had a shared expectation. The old rule had some language that had frankly never been enforced by council against itself, which required there to be an emergency situation, because the Brown Act, of course, requires pre-planning. So that really was inconsistent. And so I think council had a sensible, or the committee had a sensible approach to that, which was to recommend a specific number of times.
Yeah. So it was like 3 times a year or something.
Right.
Yeah, so I do think, again, with fewer council members, we definitely should allow conference calling. I don't think we should limit it geographically. I do think it's possible we should encourage video calls. So, you know, if we're going to create a list for future topics, I definitely think, you know, pulling things from consent, something we should talk about. I'd really like to see some practices in other cities with the smaller council size. I think kind of aligning and clarifying the rules for some of the council's appointed boards and commissions, you know, Planning Commission, ARB, that kind of stuff. I think those vary in different ways, and it might be good to kind of get those aligned. And then the big one that I'd like to throw out there is that we review the swearing-in date after an election. And again, I think we seem to be kind of an outlier compared to other cities around us and waiting until January. And so I think it's worth a discussion about, you know, do we swear in new members at the first or second meeting after an election? I think you eliminate this kind of period of, you know, things not matching the electorate, and you can be addressing policy issues with outgoing council members.
So just point of information on that.
Yeah.
So the charter has a rule on it which would require a charter amendment change, which is that council member terms are through the 31st of December. So we had previously talked about swearing in new council members on the 1st of January. The swearing in does not have to occur at a meeting. It can be done, you know, privately.
The council can make a charter amendment. Yeah.
Council can propose a charter amendment, of course.
So I mean, if we wanted to do it mid-November or whatever.
Wanted to point out that was not a simple matter of changing these policies.
Again, I'm just saying I think it's something we should discuss. And
when is the charter election? Can that take place?
General municipal election, if it has no impacts on organized labor, in which case it has to be, yeah. So I think there's more flexibility on this one. Yeah.
Yeah. So I guess I'll stop there for my first round of comments.
Okay. Just so everyone knows, I am taking note of the big items you're pulling out, and I'll plan to kind of go over them all at the end. And I'll share with staff if we need. Councilmember Holman.
Okay, good, thanks. One of mine also is like how long speakers, either oral communications or during an item, gets to speak. Let me just make one comment too. It's like my comments that are here got printed in a fashion that's different than how I had submitted them, so some of them seem a little bit nonsensical. It just happened. So some of them are like, you know, sub-points or a note or something like that, and they got numbered as individual things, and they're not. So my list isn't really this long. So anyway, but the time that speakers are allowed to speak, I think, is a critical issue. You know, on page 44 of the procedures protocol, talks about meaningful public involvement, and I think that's really important. And that has to do directly, I think, with how long members of the public have to speak, whether oral communications or to an item. I don't think it should ever be less than 2 minutes. We've heard many, many, many comments about 1 minute not being adequate to do anything or for us to hear anything. So that. I think it's also, after I joined the council, we put something in the procedures and protocols that said that, because this was happening, fairly frequently, that an applicant couldn't submit late materials and that topic be, or that new proposal be considered at the same meeting. It had to be continued and then reviewed by whatever body or entity would result in the council being informed when they considered something. I think the same thing applies to the council. We need to impose this on ourselves. There have been some things that are pretty significant that have been proposed by council members at the meeting. They really should not be considered at that same meeting. They need to be considered by the entity that would review them. For instance, the CAC, when the programs were all pulled out of the comprehensive plan, the CAC had no notion, as far as I know, the staff had no notion of that. What's the implication of that? What are the impacts of that? So just as an example, but I think we ought to hold ourselves to the same standard that we hold applicants. I think it makes perfect sense.
Molly, you want to?
So just to, not to stop you, but just on that point, there is a clear legal boundary on this topic, which is when the council might get into an area that has not been noticed to the public, and then the Brown Act doesn't allow you to entertain a new proposal that's beyond the scope of what you've noticed. And I will sometimes remind council of that, and we have to then notice something for the next meeting. Before you get to that legal boundary, though, what I'm hearing you suggest is that there's some other line that could be drawn. And this is one area where I have a high concern about potential difference of perspective. A lot of that is in the eye of the beholder. So, for example, it's very common, in fact, it's probably the norm, that on a given topic, council makes some adjustments to what the staff has proposed and printed in the staff report. It's very, very common that council members will make adjustments, say, okay, let's increase this, or increase the setback from 6 feet to 8 feet. So is that a new idea that needs to be noticed and continued or not? So I don't want to get into specifics, but I want to note for you the challenge of making a rule that you yourselves all agree on where that is. Because here's my selfish concern as your city attorney, and I speak on behalf of myself and whoever sits in my chair in the future. Do not look to your city attorney, to make those calls, because it's a very, very challenging area.
Well, let me say this. It's we've not had in the several years that we have this procedure added to our procedures and protocols about a significant change to a project submitted by an applicant. It's never come into question like what's significant mean. And I think I don't think taking, and I don't mean to pick on anybody here, but I think if we're talking about pulling all the programs out of the comp plan, to use one of the examples that really caused me to kind of go, wow, I don't know how that would be considered anything but significant when this had gone through all the review of the CAC committee. I mean, I think rational minds can agree what's significant, what isn't significant. It's like, increasing a setback, for instance, or increasing or decreasing a height of something. It's like, I don't think that's significant. I'm talking about, like, again, what reasonable rational minds can determine to be significant, as has worked with project applications. So that's where I'm headed. That's what my intention is. You're looking really askance at me.
So again, with project applications, there's a legal principle at work there. So it's the rules of due process, and we have cases that help us define that. With due respect, Councilmember Holman, if you asked your 8 colleagues about the specific example you're noting and whether that's significant or not, you are not going to get the same answer from all 8 of them. So it is an area of judgment. And what you've characterized as significant for very good reasons, which you've articulated, others would say was a formatting issue and relatively minor. So I don't take sides. I simply note you as a group do not agree. So please make rules where you as a group can more often than not interpret and apply them yourselves.
Can I jump in now? There's no way we're going to resolve this one tonight. I mean,
I don't expect to, but I want it to be considered.
But no, I mean, the idea of identifying it as an issue for discussion, I think, is appropriate and noteworthy, and ought to be part of what is carried. I don't think Molly was trying to dismiss this going forward, just to sort of identify that, this may have more more different perspectives and some other things we have. There may be more, some of these things are going to be much simpler than others. But I don't think, and I don't mean to be presumptuous, Mr. Chairman, but I wouldn't think that you're so much going to be culling out concepts or ideas that council members advanced tonight from being forwarded to the consideration of the staff and the council.
Yeah, and I didn't think that the city attorney was trying to dismiss my thought. I think we just have a different theory on the approach. So, the number of people it takes to pull something from consent, we got an email today from Shani Kleinhaus who gives examples. Well, she quotes from the California Code of Regulation, which I think ought to be considered as this is looked at going forward. And I tried, and it actually lost on a 4-4-1 vote at council. We ought to at least reduce it to 2. 3 is such a huge high bar. If you look at what Shani Kleinhaus goes to a lot of different cities because of her role as the Audubon Society's representative, and no one has 3. Some have none. And I can, in my own head, it doesn't take much to look at, like, what the concern might be for none. It might be a member of the public. So it doesn't take a lot to go there. But I do think that this ought to be considered. How we are not consistent with the California Code of Regulation, and what the high bar is for pulling something currently off consent. 3 of 7 is basically half. Basically half, because you can only talk to 2 other people, and that's it, period. So going along with that, and this was discussed at the last consideration of procedures and protocols, is what goes on consent. And I have heard grumblings from pretty much every council member that can't say every, but pretty much every council member that I've served with, which is several over my 9 years here, about what's on consent, why is it there, it's not had any other review. I think there do need to be very specific standards and guidance for what goes on consent and what doesn't go on consent. It's troubling to me that we can approve millions of dollars on consent calendar with no finance committee review, no UAC review, those sorts of things. So, again, that was discussed previously. I guess maybe this is the time I would insert that I've been really very concerned, if not upset, that these have not been reviewed on an annual basis or even on a semi-annual basis. Because it does say very clearly that they're supposed to be reviewed by the Policy and Services Committee at the beginning of every legislative year, and it's just not happened for how many years now. I don't anticipate, having gone through this before on Policy and Services, I don't anticipate that it would ever be a total rewrite, but there are some things that need to be updated and considered. I've tried for a long time to get these to come to Policy and Services this year, to only have them now in middle of November. Something where I have heard other council members agree on this, that a council member who's going to vote no on a consent calendar item would be given the opportunity to speak as to why the no vote prior to the vote. And that is such that I think Councilmember Fine, you may be one that was agreeing with me. I don't want to put words in your mouth here, but others have agreed, because it doesn't make much sense to speak after you voted. The point is not just to say why you reject the item, but also it's an opportunity to explain to others why you're voting no, because others may or may not have the same opinion, but it takes away the opportunity for others to chime in or not. I've thought for a long time of the purpose of study sessions and how to give clear guidance, again, non-binding, but give clear guidance, especially on those study sessions that are brought forward by the city staff for city staff feedback, or council feedback to the city staff. I think we could do a whole lot better than we do currently. City staff leaves and kind of goes, what did we hear? And how much did we hear? Because also the way we do it is we speak in sequence. And so if Councilmember Wolbach says something and I've spoken before him, I may agree with him, but I don't have an opportunity to concur. And so staff leaves and goes, they count heads, and they have no idea that I am agreeing with you, because there's no way to collect that information. So the CAO committee has fuzzy role of what its limitations or expanse is. That's been an issue the last few years. With this item, for instance, and other, I think the vehicle habitation, I think it needs to be clarification on how P&S and finance discussions and action can be agendized. Kind of consistent with what Tom had said earlier about when the new council should be sworn in. I would say the election of mayor and vice mayor, clarify that that's a Brown Act action. It's subject to the Brown Act, but seems to get lost most years. And also that I'd like to see the council discuss whether we should move to a system that other cities use, where it's like if you're the highest vote getter, you're in line to become mayor. I don't think we are at our best when politics is on the dais, and that's what the election of vice mayor has become, especially in the last few years. But ever since I've been on the council, it's a political issue as opposed to who's most qualified in a rotational system. I do not think it's healthy for anyone. The role of the mayor in conducting and participating in meetings to be strengthened, to be clarified pursuant to parliamentary procedures such as Robert's Rules. We've had mayors who basically just take the bully pulpit and run the meeting and greatly influence motions and outcomes, and it's not good parliamentary procedure, and I don't think it's the healthiest of ways for us to hold our meetings. We sometimes get away from this. Of course, our judicial items should be indicated on the agendas, and they are sometimes, they aren't sometimes. Conduct with Palo boards and commissions, that's been mentioned, so I won't repeat that, other than just take a moment just to say, I've mentioned this before, and yes, board members and staff members can read parliamentary procedures, but this year I've had several occasions to witness where chairs and staff members not understanding the basics of parliamentary procedure have caused long, drawn-out discussions for no purpose and no need. 20 minutes at one commission member meeting just trying to discuss about whether they could discuss something that wasn't on the agenda. The chair didn't know that. The committee members didn't know that. The commission members didn't know that. The staff didn't know. I finally had to insert myself, and even after that, there was more discussion about, we can't or can't discuss something that's not on the agenda. It's just that we need to have some training, and, but it's not the only occasion. There have been other occasions where just lack of board and commissions having basic parliamentary procedure. I don't remember why I put staff conduct with city council here. Because, again, I got kind of out of order. Oh, I know what it was. 22 and 23 are subsets under 21, and you can read those on yourselves. And also the role of this body. The role of P&S was essentially broadened a few years ago to balance out the workload with finance, because finance was reviewing items that could just as easily have been policy issues that came to this body, and it was to do a few things. It was to balance out the load of work between finance and policy and services, and it also was to raise the import, if you will, of policy and services, because there's like clamor to sometimes get on finance, thinking that policy and services is like not a place you want to serve because they don't do anything. And I would say that this year that's kind of been true. We haven't done much this year. Our agendas have been light and not that meaty until tonight. So I will leave it at that. This is just one. I'm gonna channel Larry Klein here for a moment, and that is on packet page 372. The mayor of the council, under appointment, the mayor of the city council may appoint 3 or less members. Channeling Larry Klein, it's fewer, not rather than less. Thanks.
Okay, thank you all very much. I'm going to go over all your comments at the end, and then I'll send them to you, Rob, if that's okay.
And they are printed up here,
Yeah,
except
I've just kind of
not formatted as I had sent them in.
I've just kind of synopsized the main points each of you have made, and I'll go over those at the end. So my big points, where did I put those? I'll just go through them. So on speaker time limits, we've all mentioned it. I think it's important we do have some limits. I think 3 minutes for a basis is totally reasonable, but when we have a lot of members of the public, it is important for us to conduct our business efficiently. And the idea I kind of heard about from some other council members and colleagues is that in Fremont, the speaker cards, the public comment cards, actually indicate how long you'll have. So if there's 1 to 10 speakers, you get 3 minutes each. If it's 11 to 20, you get 2 minutes each. 21 plus is at the chair's discretion. And I think that may be something we want to pursue. I think there absolutely are times we want to move to 2 minutes for public speakers. I agree with Councilmember Holman, we should avoid 1 minute at all costs, but at least in my short time, there have been, at least 2 or 3 items where we have 60-plus speakers. Each of them, 2 minutes, that's 2 hours, and you also have to add, 20% float time. And I think it does a few things. One, it has council kind of lose the trail, especially if we've been sitting there for 2 hours, and then we're getting into the action item much later in the night. We're not at our sharpest. And 2, it potentially kicks out other items to a next agenda, which can be injurious to the city. Let me just go through mine? Thank you. There is a question of what goes on consent, and this is kind of, a trust of staff versus oversight of staff issue. I agree there have been a few times there have been big ticket items, and I wonder if some kind of monetary threshold is helpful. That said, for the most part, this is set by the mayor and vice mayor, and they kind of sign off on it. But I did note in the 2015 meeting minutes, you fellows did speak about maybe some kind of threshold for what goes in consent in terms of a money limit. But I mean, let's be honest, some policies are just as important as the money we spend, so it's a hard judgment to make. On pulling consent items, I'm open to persuasion, but I personally, my gut's telling me that we should leave it at 3 for the moment. I think in the past 2 years, we've pulled a lot of items, and by my count, all of them we've passed except the council chamber upgrades. And so there is a large staff cost, actually, whether we're kicking it back to a committee, pulling it up for discussion that night or another night. There is a cost to staff and to city and to residents, both in terms of policy, in terms of council time, and in terms of dollars spent. So I think those are important considerations. One question or comment, I guess, the review of these policies and procedures or protocols and procedures. Right now it does say it's required, but it doesn't seem like we're very good at that. And so I wonder if it's not helpful to make it optional, especially after we do this refresh. On the issue of telephonic attendance, I do agree with Councilmember Du Bois. If we can get video calling, that's great. I think it makes it a little more participatory, although maybe that's contingent on the council upgrades, council chamber upgrades. Also on that note, I think a limit of like 3 or 5 per year is totally reasonable, especially with a shrinking council. The one thing I've noted on there, and I think is a little funny, it does say, the site must be accessible to the Americans with Disability Act, or required with that. I doubt that any place abroad is compliant with the Americans with Disabilities Act. And so I'm not sold one way or the other. I'm agnostic, but we may want to consider either deleting that requirement or saying you can only dial in domestically. That it's ADA accessible. So I mean, by my
Or the international equivalent if you're overseas.
well, but if it's actual requirement that it's ADA accessible, like I doubt a hotel room in Shanghai or Paris.
The details of how that applied to an international location.
Yeah.
I imagine we can make a very good argument for an equivalency.
Okay. Fair enough. I think we should just get some kind of concurrence on that. It seems like most of us are okay with folks dialing in. I just know I've seen it over the years. Sometimes council allows it, sometimes not, and we should be really concrete about that. Councilmember Wolbach brought up the idea of at 10 o'clock or 10:30 having a check-in. I'll just note that's mostly on us to decide if we want to proceed. And sometimes we've been good about it, often not. One other item, I don't think we're necessarily the greatest at this. Sometimes I hear from staff about the 1 hour per council member, especially around council member questions on agenda items. And we may want to, at a later discussion, kind of revise what we're trying to get out of council member questions. You know, sometimes I will shoot off a message saying like, hey, is this number right? Or can you tell me some more about this? And it's a quick direction. Other times, I think council members are kind of seeking assurance for why they may want to pull an item or why they should support it. And so I think we need to be a little more specific about what the intent of council member questions are and how to make sure they don't negatively impact staff and the public's work. I think that's something we should be looking at. On council committee votes, so like this committee, for instance, I would recommend that you don't need unanimous agreement for the item to go on consent. I know there have been a number of times, especially at finance, where we have essentially a 3-to-1 vote, and then it has to be rehashed at the council level. I'm not sure that's necessarily helpful, and I would be happy to hear the minority's report on that. So council committee votes. So for instance, let's say we recommend this and it's a 3-to-1 vote. It automatically goes on the action agenda. I think there may be some cases where at the mayor and vice mayor's decision, a non-unanimous vote can go on the consent calendar from a committee. I just know we've had a few of those from finance this past year. Lots of people have brought it up about a clock for council speaking time. I really think we should try that next year, even if it's just like a count-up clock showing us how long each of us have talked, and we can implement that really easily, I think, just a digital timer that we can all see. One quick question for the city attorney. I know we moved a lot of our vote thresholds to a simple majority, but I was reading through this, and calling the question right now calls for a two-thirds majority. And do we want to move that to a simple majority?
So that is modeled after Robert's rules, and the reason for that is there are a couple of procedural things you'll see in that chart that do have a higher voting threshold, and the reason is to prevent the majority from simply closing out debate early on.
Okay.
It's to require a higher threshold so that perhaps if there is a smaller minority that is insisting on debate that's become so lengthy that it's unproductive, that a larger majority can say we're done discussing.
Okay, I just wanted to match our different majority votes and see how that works. So I've just got a couple more, and I will absolutely turn it back to you guys. On pulling, I talked about pulling items from consent calendar. We haven't really solidified when you're required to notify staff or the mayor about pulling those items, and I don't know if it's appropriate for us to have some kind of, requirement that it must be 24 hours prior, because, of course, sometimes we get late-breaking news or inputs, but we may want to check that. For voting no on consent, Councilmember Holman, you are right. We did talk about this at the last meeting, and I was kind of thinking, oh, it's not a bad idea. Maybe we should allow the person to speak first, and then they can vote no. On the other hand, I was thinking about it, and that's when I would pull an item, actually. And so I'm not – alarm? I think we're okay. So I'm not sure, but it may be a point of discussion, whether we leave it as is or switch it.
Do you have anything to say on that? I mean, it sort of starts to run into an actual conversation. I mean, if one person wants to speak on no, I guess your rules say somebody can't counter with a yes argument, I guess, but then somebody else says, well, I want to speak on no, and you're pretty quickly into an item that needs to be pulled and have a free-form discussion, because one person could unduly have more to say, in a sense, you know what I mean, prior to a decision to pull it or whatever, I guess.
Yeah, and the council has, occasionally council members have had short questions that haven't gotten submitted through the regular question process, and council members would just like to ask them, but it sneaks into this where other council members then say, well, but maybe there is an opinion or a suggestion in the question and I want to respond, et cetera. And there's also some tension then if you hear the no argument and say, oh, well, I'd like to also vote no or pull it, then there's tension between that and the rule about notifying the staff when you're going to pull.
Okay, that's super helpful. On study sessions, it'd be nice to get some more definition, but I haven't seen much trouble over the past year, so I'm happy to discuss it more, but I don't have any specific issues there. One thing that has come up a number of times, which has kind of bugged me, and this is mainly on the mayor actually, is when, I guess the rule is only the presiding officer can identify people to speak. And I think there have been a few times in the past year or two where we've allowed, members of the public to shout out and things like that, and then we respond to them, or we just poll people quickly in the audience. And I think it's incumbent upon each of us to really limit that behavior and make sure that the chair is identifying speakers to come to the mic, speak up if we need them or not. I think we sometimes privilege the loudest folks in the room, and that can be injurious. I have to bring up calling the question. So I think those are all of mine. I do have a list of everybody's. I don't know if I need to go through it, and I'll send it to Rob and everyone. But I do want to make a quick motion, and it's pretty basic, and I think...
Can we do a quick for the rest?
Okay, let's do one more. All right.
Because we triggered things.
Yeah, well, and I was going to, as I said before, I'd be happy to make a motion, but I'm happy to defer to the chair as well. Just a couple of thoughts, a real question about how much we want to try to get done tonight, right? So it's, practicing what's in there about, time management, right? We're coming up on 9 o'clock, coming up on beginning a 4th hour of this meeting. This is an important item. I'm willing to spend a little bit more time on it for sure, but I think we should be clear, maybe before I or the chair makes a motion, to be clear about how much we want to try to get done tonight. Do we want to just continue to articulate a list of questions to forward to the future, or to council and then to the next council or to Policy and Services to return with in January, or do we want to offer some specific recommendations and on some of these high-level items, and then also an additional list for consideration by the new council? I've got a couple other thoughts, but I don't know if the chair or
I'll just tell you. The motion I was going to make, and I hope we can all agree to this, is roughly starting with the 2015 revisions. Direct staff and the language can be worked to slim down this document and focusing on protocols, which are community to council interactions, and procedures, council to council interactions. So there's maybe a bit of bifurcation that has to go there, but roughly revising and focusing this document a bit. And then the second part, I think I've heard from a lot of you, and hopefully is not contentious, is next year have, whether it's an ad hoc committee or the mayor and vice mayor, to evaluate our committees and regional assignments, their needs, their status, and what is required of them by the council. Speaking to your issue, maybe it's community members that can get appointed. Maybe there's some committees we can drop, but that just seems to be something. And then I would also just, forward this list of these 30-odd items we brought up so far for a further discussion.
And to the staff to come back to the council in the new year in some fashion.
Yeah.
And if I could just speak to what Corey was saying, what I'd heard so far was generally that concept, including the fact that Tom had suggested a second round. So by the time we do a second round and get ready forward, it's going to be, I don't know what it is, after 9:30 or something. I'm just taking a guess. So okay, all right.
Thanks. Do you want to make that motion now, or do you want to hear from us before you make it?
Let's go through the second round. Councilmember Holman, you asked clarifying.
Yeah, clarify the last thing that you mentioned, please.
Sure. So I don't know the exact wording, but some kind of, whether it's an ad hoc group of the council or next year's mayor and vice mayor, to work with senior staff on our standing committees, regional assignments, their needs and their status. So
why wouldn't it be Policy and Services?
Could be PNS, sure. I don't have a huge preference there. I just think, I didn't count, but Tom, I think you said there are 37.
I think, I think it should be Policy and Services, and here's the other reason why, is because there are 37, and that's just boards and commissions and community assignments, but like La Comida, blah, 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 blah. But there are also other assignments that are made, too. that are not listed in terms of assignments to be made that come through ABAG and various other entities. So it's really more than that. And some of that isn't very transparent. I tried to make it more transparent 3 years ago, but it didn't happen. So I think Policy and Services should review that.
I'm totally okay with it. I just think we need some evaluation process of that.
Just a quick comment on the motion. I'd like to see just a really simple motion that says, we've got the 2015 revisions and what was we generate tonight, P&S early next year.
Yeah, no, I think that's what it is. I just think I'm totally cool with that. I just think there was a bit of, at least in my reading of this, it kind of went back and forth between the, community to council interactions and the council to council interactions, and I think there's a little bit of separation there that could happen. But
figure that out.
Sure. Okay.
So, yeah, so I'll just make a couple more comments just to have them on the record and responding to some of this discussion and adding my thoughts. So I think we'd probably want the protocols to be the council to council, and then the procedures are for the public to the council. And on this question, there are a couple of things here. On the question of if one of us votes, or if the council member wants to vote no on a consent item, I think the city manager is trying to get to what I feel pretty strongly. I have a strong view on this, which is, if the goal is to persuade people to deliberate on an item and persuade people to change their position on it, that requires the opportunity for deliberation, and that calls for pulling something from consent. I would be personally open to changing the number of people to pull from consent. I don't think we're going to make that change tonight, but I think that leaving the no vote explanation until after the vote on consent items, I think, is really important. Otherwise, it's like, what's the point of pulling things? On the question of significant policy proposals introduced by council members, operating and speaking and making motions within the purview of a properly agendized item, my view on this is also very strong. That, and the next council may disagree, but my view on this is quite strong. That is not a violation of our duty, but is exactly the job of a deliberative legislative body. That's why we do and that's actually part of why we do second readings, right? And that's part of why, unlike, when an applicant brings something to us, we want to be, as the deliberative body, able to consider, able to have time to consider something when it's coming from an outside source. But as a deliberative body, we can deliberate, and it is our job to deliberate, convince each other, have discussion, come up with ideas, sometimes on the fly, because of something we've heard from one another. And again, that's why we have second readings. As for the specific example that was cited, I think I was the one who made that motion, and I was the one who, through our process, when it came back, was the one to say, you know what, I have heard from people through our process and think, we should change that formatting back to the original intent. And I think every member of this council, and especially every member of this committee, without, we could go back and find a lot of specifics for each of us, but each and every one of us has at some time introduced significant, sometimes complex motions or a complex series of amendments during a meeting, because that's our job. That's what we're supposed to do. Hopefully they're not overly complex, but that's up to us to evaluate. So I do not think that we should prohibit that. I would not want to see the future council prohibited from doing their job. As far as who should be the body to sort through that list of assignments, I do think it should be the mayor and the vice mayor, the city manager, and the city clerk. That would be my recommendation. I do think making it transparent, making it available, making it clear is important. I appreciate Councilmember Holman's, former Mayor Holman's attempts to introduce greater clarity and transparency about that. I think that that is important. But currently it's just the mayor making assignments, and I think it would actually be an improvement to have the mayor, the vice mayor, city manager, and clerk all sit down and work that out. Basically, that would be the sort of ad hoc committee to go through assignments at the start of each year once the new mayor and the new leadership team has been established. And so that's just my personal recommendation. I think we could talk about each of these in greater depth. There is actually one other I'll say, just to add clarity. If there is a time, because we've got 60 or 100 public speakers, right, where the chair of a meeting, mayor or chair of a committee says, we're going to limit it to only 1 minute per speaker, in those cases, this is where I would actually say, let's create a carrot, an incentive for people to pool their speaker cards. And my recommendation for that would be, even if we are limiting individual speakers to 1 minute apiece, we still allow 5 combined speakers, with one person speaking for 5, still give them 10 minutes. And that means that group would have an average of 2 minutes per speaker. It would encourage people to have one clear spokesperson who, as I mentioned before, they usually get better comments from them than you do just from each person running up and saying, me too. And so that would be a way that even if we have to limit the time that people speak to 1 minute, again, at the chair's discretion, in rare cases, hopefully, people could still get their 2 minutes by pooling. So that would be my recommendation for that. So that's just something for future consideration. I'll leave it at that.
Councilmember Du Bois.
Just a couple thoughts, reactions to things I heard. So I was just looking, Berkeley actually has an interesting one. I don't know if it was that way when you were there, Jim, but it looks like any council member can put in a consent item as an action item, and they can make any action item a consent item.
Can I tell you about this? Because that's a fantastic system. The council members can, first of all, they're districts, and each council member has 1 or 2 staff people. So any council member can put any item on the consent calendar unilaterally. So what you often have is multiple items sometimes from different council members on the same item, somewhat people struggling for who gets the credit for the item, and then people pulling the items to be heard so they couldn't be heard. So we would get halfway through the year and there would be a carryover item of like 250 consent items that had been pulled off because everybody was wrestling with who gets to frame the issue. It was, so I would just say there's always.
So I do wonder, so maybe that's not the greatest way to do it.
It's a hell of a packet every week.
But I do think there's something to say about thinking about, like, are there some self-enforcing processes where you basically give council members more responsibility and they need to live up to that responsibility through peer pressure. Some comments on Karen's thing about the last minute significant change. I think that is tricky, but I think the intent, might be worth thinking about a process where less than a majority could trigger a continuation of an item. And it could be similar to the number needed to pull something from consent. And so I think it would be similar to pulling something from consent. It would require trust among the council that it not be misused, but it would be a way if, there was something that felt large or significant that you could basically, if you had support, move that it be continued. And it's kind of this, again, we're talking about process, not, kind of who's on council today, but it's this idea of kind of what's a majority, what's a minority do. The idea about highest vote getter becoming mayor, at some point is interesting. I think there's definitely value to being on council for a year or two.
But not this election cycle, right?
Yeah. Well, so again, if it's a brand new person who's a top vote getter, does that mean you're in line in the rotation, but maybe not the next year kind of thing? I don't know how that would work. But other cities do have rotations that seem to handle this, and I do think they factor in votes, but I'm not exactly sure how it works. You didn't mention it, but you had written it down. I do think the idea of the rail committee being a committee of the whole might make some sense given its importance and people we have that have conflicts. I kind of disagree with, well, a couple of thoughts. You said that you thought only one item that was pulled didn't pass, but I do know we pulled some items and sent them to committees where they got tweaked and passed. So I think there's value in that. And we had a lot of discussion last time about putting items on consent versus action subcommittees, and we actually went the other way. Most of our discussion focused on when it was unanimous, we still wanted it to be an action item. And so I kind of feel pretty strongly that if it's not unanimous in subcommittee, then it should go to the council. And I think the intention there is if the committees are doing council's work, and if they can't agree, then it should probably go to the full council for discussion. We also talked a lot about clock, and I still like an idea of some kind of chess clock where each council member would have, and it could be really soft, not enforced, but you could see it. So you have 30 minutes of speaking time at a meeting, and you decide how you want to allocate it between items. So it's not even a per item, it's how much airtime are you taking up in the evening. Yes. We do have, in the red lines that were not adopted, we did have a suggestion that pulling an item happened by noon on Sunday, and again, it was a suggestion as a policy. I kind of agree with Councilmember Wolbeck and some of the discussion that if it is on consent, it makes sense to speak after the vote so that it doesn't become an action item. So I kind of like that process. And I wasn't quite sure what you were saying at the very end, but I think the process change for the committees should be something that P&S talks about, but the actual appointment should be with the mayor, right? So I think there's a difference there. Yeah, and the idea of like including the vice mayor, I'm not sure, you get ties, and then if you pull in the city manager, it seems a little strange. So it seems to be a benefit of being mayor that you appoint committees. So, yeah.
So I definitely wasn't trying to change that the mayor appoints committee representations and things. I was just trying to figure out who might, in 2019, evaluate which committees we're a part of.
Yeah, so I think it makes sense that P&S would kind of talk about it and make a recommendation to me. But so, and I want to be. I said we want to be here until 9:30, so I'm going to stop.
And I won't fill the time till 9:30. I agree with what Councilmember Du Bois just said about P&S evaluating which boards and commissions to continue, and the mayor would still appoint to those representative roles. The thing about the last minute and significant proposals by either staff or council, I mean, it hasn't happened more than a very small handful of times in 9 years. But I think just to, harp, I guess you could say, on the removing the programs in the comp plan, again, pointing to what's referenced in our procedures and protocols, it is meaningful public involvement. I think we saw the meaningful public involvement and their distaste for that significant change by having a big outcry, and we actually reversed that action. So, I with all due respect to the city attorney, I think it would be a rare occasion, and I think we can monitor ourselves on that. But I just think there are some things that happened of the last couple of years that have just been a little upsetting to the public and to some council members. When it's your turn. The time to speak, the amount of time to speak, going down to less than 2 minutes, and maybe City Manager Keene can respond to this, but it is part of agenda setting. You know, it is more art than science, and it's not perfect by any means, but if one is plugged into the community and staff hears from people, you can pretty well estimate or guesstimate on most occasions whether there's going to be a big crowd turn out for something or not. And you base the agenda on that. So you don't set 3 major discussion items and one of them is going to have 30 people show up or 40 people show up. It's part of agenda management. It isn't just, you know, if we get a lot of people show up, the time for the speakers is going to be cut down. It's part of basic meeting management. I never cut people to 1 minute when I was mayor, ever. And I didn't find it necessary to do so to get through agendas. And not to be, you know, it just didn't happen. I think some of the things I agree with Councilmember Du Bois on this. Some of the things that were pulled from consent, they were referred sometimes to, I think more often to finance to get further vetting, and then they came back with clarification. I think the other thing that happens, even when there may be a yes at the end, when some things are pulled from consent, it's, I think of appeals on this sometimes. It's, you're just not going to hear everything. You're not going to hear the back and forth that you hear, to use as an example, appeals. If you pull them and you get to hear them, then you get to hear the different perspectives of the different players. And even if the answer is still yes, I think it's a very important public process to go through, and important for the City Council to understand and respect that there is, on some occasions, much to be learned, and it respects our appeal process too. To never pull anything off consent that's an appeal, I think would be a great disrespect of the public and our processes. It happens sometimes that it comes up sometimes that City Council members it's recommended that City Council members each limit their time to, it's been proposed like 5 minutes or something like that. I always have a little bit of a difficulty with that because there are, again, having served on several different councils, different council members have different expertise in different areas. And so to limit every council member to the same amount of time doesn't allow the rest of the council to enjoy what the expertise is of some of the other council members. So I'm sure whatever happens is not going to be held to a strict rule. I would hope it wouldn't be anyway, but it does have that complicating factor to it because not all items are created equally, and not all council members' knowledge and expertise in a given area is created equal. I think that was it. And I didn't mean to cut you off, Councilmember Wolbach. I just wanted to finish my list.
Did you have a quick point? Yeah, I'll be quick. No, it was, you know, again, I think we could we could probably relitigate the comprehensive plan in many aspects of it ad nauseum. Just a couple of thoughts on that, and then a couple other points. I think the city attorney was right that we will have different points of view among different council members about not only that, but in my view, we make we introduce substantial ideas all the time. I don't think it happens occasionally. I think it happens all the time. I think everybody who's sitting up here right now has done it multiple times, and I think that's a regular part of our process. In that particular case, I do think it was a formatting change, and we heard from the public. The process worked, and the original formatting was restored through our current process. The process worked. The public had a chance to weigh in before it was put into practice. I think that the idea of a minority of council, it's another topic that was raised, the idea of a minority of council being able to force something to be continued, I think is a real invitation for obstructionism. And it's like a filibuster, but you don't even have to keep talking. I would really strongly recommend against that. And I think that the idea of a non-binding but informational councilmember speaking tracking system, the chess clock per meeting or even per month or per year, I think is a really great idea. Not binding, but just a little bit of public shaming.
All right. Thank you all. In the interest of being efficient and effective, there's a lot of good ideas here. I will send this full list to Rob tomorrow, so you can forward it to all four of us so we can just review. But with that, I'm going to make a pretty basic motion. So starting with the 2015 revisions, return to council with a revised protocols and procedures document, including the discussion of the items raised tonight. And then separate from that, or also return to policy and services with a discussion of council assignments, needs, and status.
Second.
Thank you. So just the first part is let's revise this document, slim it down, eliminate things we don't need, but work on the revisions already made, and contemplate kind of a workup to all the items we've raised tonight. And the second piece, my God, that car is driving me nuts. Sorry. Code enforcement. And the second piece is returning to policy and services with a discussion of the status, needs, and assignments, so we can evaluate, which ones we need to focus on, whether we need attendance, whether we need report backs. Just to figure out, as Councilmember Du Bois mentioned, whether we want to appoint citizens or other folks to attend those in our stead. So we have a first, we have a second. Do you want to speak to it? I see you can. Nope, I think it's good to go. Okay, Councilmember Holman.
Clarify what you mean by slimming down and taking out the things we don't need, because we didn't talk about taking anything out. So clarify what you mean by that.
Sure, so I just saw...
And then also there was committee of the whole in the 2015, and I don't know that we actually have committee of the whole.
No, I don't. What do you...
Yeah, committee of the whole was committee of the whole was...
We've had a few.
Yeah. But I mean, is that the 2015?
It is.
It was. So just to remind folks, you can use that procedure without having specific mention of it in your protocols. So if it's something that you're going to use fairly rarely, I would suggest maybe you don't make a special rule on it.
Okay.
And then clarification around slimming down.
It's actually not in the motion. It's more just some comments I picked up on the staff report in my reading of this. This document is pretty long. There kind of are two natural sections. One is, community to council staff. The other is council to council staff. And I think we could just clean it up a little bit.
Yeah.
That's all. And then there's a few sections that are actually duplicated, I noticed in there, such as like what the agenda is and what a study session is. There's it's in 2 or 3 parts. It's just things like that.
I heard this not being content-based at all, but just clarity. If we have redundancy or whatever, they just look at that, and we would redline it anyway.
That helps. Thank you.
All right. All those in favor? Aye. 4 in favor, none against. Thank you very much.
Well, no, since I won't get to be here with you guys next year when you go through this. Gee whiz.
Come back.
Well, I want 3 minutes when I come back. If I could just offer just 2 little comments, as long as you don't get into a discussion about them, okay? So, number one, I do think that the challenge for you all always governing is what Harlan and Cleveland say, which is how do you get everyone in on the action and still have action, right? And I don't think you should lose sight of the fact that you meet a lot and you have very long meetings. And so there is an art, as Mayor Holman pointed out from her time, of trying to schedule the items in the agenda. I do think the role of the mayor and the vice mayor in that process also is a way to help inform sort of community perspective as it relates to dealing with the time on issues. And so when you think about consent items and pulling them, you do need to realize that starts to have a ripple effect impact also on the action. And I wouldn't say that there's been that much that the council has been complaining about there too many inappropriate things on the action item. We're not swapping action items with consent items. So you just need to keep that in mind. The second thing, just 2 other thoughts. I do think that some discussion about the mayor's role in getting that clearer, and even thinking, I'm not saying what sort of particular training or whatever there is for mayor, but we really do suffer from the turnover in a year. I mean, with a longer-term mayor, the person does sort of have more time in to get and more feedback from the council members. So I think that's really important. And you do depend upon the mayor in helping shape the agendas. I would offer that you should not reduce the pulling of consent below 2 people. If you were to say none or one, you're essentially going to say one person trumps the mayor's role and vice mayor's role in setting the agenda. I mean, the agenda isn't set by what you want to keep or not keep. It really is saying what's the best use of our time within your policies and how to get through things with the amount of meetings that you have. And so for one person to pull something off, in a lot of ways, if you had one person who was always pulling something off, they're sort of de facto mayor in a sense. Just want you to think about that. And then lastly, the other thing on consent, I do think that you do want to think about if you establish more clarity about what are the requirements for consent, that the council really sticks to two responsibilities on its part. One, if you are going to pull something off, to really set an advance deadline and really honor that and let the staff know. And two, as much as possible, to try to use questions if you can to say, if you could answer this question, that would keep me from pulling something off, because it is really unfair to the public too. Your goal in setting the agenda is to try to predict for the public what's going to take place in a given night. And so even if we pull stuff off on consent, we take it up that night, it has some impact on the action item. And there are often people who are complaining like, gosh, I thought they were going to take this item up, then they did this, what's going on? Or even more importantly, we either have a whole bunch of staff sitting around, we're trying to guess who needs to be here if the council wants to pull something off, or we clearly have to say, well, we can't take it up that night even if we could because we don't have the right staff people there. So I think the advance notice, certainly before we ever get into a meeting, is really, really essential for us to just be sure, because you may say we want to pull it off. We say, well, we might be able to answer a few questions if you have it. We have the people there, but if we don't have it, we always have to schedule it. And then the last thing I just would say is you haven't really had any discussion about how you get meaningful feedback from the staff about the impact of the motions you make or the implications. So you're talking about if something have a major impact or a minor impact. From my perspective, in 10 years here, I would say every meeting the council makes substantive or significant changes to what the staff has been working on, often for months, in the course of an hour. And you will notice that there is just an art that the city manager displays on trying to assess whether or not we can accept that or say it's too much. And I will tell you that I think we've done a pretty good job of that here, but I wouldn't say, and it's for a future discussion, the factors we use in judging that are not all the optimal factors. There are many times we accept something because it's going to be just too much to just go back all over, even though you're actually giving worse direction from our point of view, but we don't have a way to give it back. Or there's often I've said, yeah, we can do that, and I have a department head screaming mad, I don't believe you said that, So I'm just saying that, and then there's not peace in the realm for weeks sometimes. So I do think some way to figure out how you modulate the feedback from the staff as well as from your colleagues about the implications of changes that you make in the course of a meeting is something really important. Well, I don't know about the protocols. I'm just saying, and we don't have to get into it, you guys have doubled down sometimes and made some really big, like, I don't care, can you cut $5 million out of that? Oh, I don't know, 5 votes? Yeah, go ahead and do it. I've been exaggerating. But it's almost like, whoa, what do we do? Okay. And in the truth, you wouldn't do that with each other really, but if you can get a majority vote, very often you're not really thinking, what is the impact on really operationalizing that with the staff? So I'm just thinking about how you have that discussion. And it's easier for me to say it since I'm departing and leaving, but but I mean, I actually enjoyed that part of trying to read the council and interpret that for the staff, but it's a big issue between the staff and the council, not so much the city manager, but the staff and the council.
So one of the things that when we did do this, I found really, really helpful and helped to minimize that impact on staff and the element of surprise is if staff reports, as we talked, if staff reports had a recommended action by the council and 2 alternatives, and all 3 of those would identify what the pros and cons are. And that actually helped to shorten the discussion by either the Planning Commission when I was there or the council earlier on. And it helped to actually curtail the element of surprise from the staff perspective. Very, very, very rarely was anything I call significant because the staff has to look at what if we did this and what if we did that anyway? So why not include those in the staff report as a recommendation and alternatives? So that's what I've always thought was and understood to be like best practice from staff reports.
Okay. Thank you all very much, Jim. Thank you for that. And Ed, we look forward to you giving us a thumbs down a bit more often.
I'll just bring Jim back.
He's installing some trapdoors under your seat.
Good enough. Good enough. I don't believe we have future meetings and agendas.
Well, we do have second Tuesday of the month, so December 11th is the December meeting.
December 11th.
We normally do have a time where we talk about priority setting because usually there's a night there's a retreat that happens early in the year, so that'll come forward. And audit updates is the only other item that I have.
Okay. Thank you. Councilmember DuBois.
So you're going to ask council members to submit their suggestions for, yeah.
Those are interesting issues that relate to the termed out or outgoing council members. How we handle that. I don't remember.
We've faced it before.
Yeah, no, I think we let them. Yeah.
I think Karen and I are happy to share our learned wisdom with.
Yeah, Tom and I will be happy to ignore them.
Most of the new council members, the new ones too, though, right?
Limited, yeah. I mean.
Okay. I think with 7 members, it means we only get 2 priorities, right?
Okay.
Good ideas, though.
It is 9:26. Let's adjourn this meeting. Thank you all so much. And Rob, I will send you this list tomorrow.